Let's do a quick howdy. Take a minute to introduce yourself. We have people who have met each other. We got a really nice mix of wiser people and some non-wiser people. I think mostly because Rosa let people know about this workshop. And I hope she'll be here pretty soon. Let's go with Eleni. Say howdy do and what you're up to real quick. Take a minute or so.
Hi, my name is Eleni Opfer, and I'm a Wiser faculty, and I'm also a lecturer at California State University in Channel Islands, which is actually not on the Channel Islands. But our campus used to be a mental hospital, and it was like California State Hospital Camarillo. So I think that's why they don't call it Cal State Camarillo. They wanted to disassociate from that. So now I'm an MFT student at Wiser, and I started just a few weeks ago, and I love it, and I really like Ronald's books that I've been reading. And you don't even have to, but I just really like his books. He tells great stories. He's really good with titles, really catchy titles. So it's like you're my role model for what I want to do. So
I have to admit, the ebooks make so little money, and they're there, and every once when Eleni bought one of them, someone bought one of my books. So it's like I'm getting a royalty of $2 and so many cents.
Wow.
I go, well, who the hell bought my book? But my books are actually on my website too, so they're free. If you don't want to send me filter $2 towards me, you could. But they were my Wiser doctorate.
Yeah.
I try to make it very readable and relatable, somewhere in between training and academic. So thank you, Elaine. Nicole, say howdy.
Hello, I'm Nicole Villaroosky. I'm a fairly new MFT student. I'm about 2 months in. That's pretty much it for now.
She's very cool because she's, among other distinctions, usually we get the older students. It's interesting to get younger blood, younger perspectives. The perspectives are always very, very great. Cool that way. Okay, cool. Tori and Robert, which I kind of knew as Bobby, we went to middle school and high school together. We go way back. Hadn't seen him in a long time.
So hi, I'm Robert Schaefer. I teach at Cal Poly in sociology. We live down in San Luis Obispo.
I've been involved with Wiser. My name is Tori Dickinson since 1980 or so. Taught there, and I always enjoy the sessions that Ronald facilitates. I think he's a great facilitator.
Bobby knew me as this quiet kid, probably.
So I've been reading, I've known you a long time, and it's great to see you, and the work you do and stuff is fabulous, and it's great to be back in the neighborhood.
Yeah, it's awesome. Hey, Alex, what's up, Alex?
Hey, I'm Alex. I have degrees in biology and sociology, almost on a decade as a clinical focused massage therapist, and I'm in the MFT program as of a few months from now. And I can second that Ronald's books are very good and helpful in learning how to do psychotherapy.
If my books actually made money, I could be profiting from all this marketing here.
Uh-huh.
See, Anne, tell us about yourself a little bit.
Hello. I'm really glad that I managed to figure out how to get into this. I did see Rose's post on it was probably the Bay Area Open Minds listserv. It was a little confusing to figure it out, but darn, it works. So I'm happy. This is a topic near and dear to my heart. I'm a licensed clinical psychologist that had a practice. It used to be in Walnut Creek, and now it's all online. I see pretty much everybody and everything from the LGBTQIA keep on going community and the poly and kink communities, and I see a lot of couples, and I also am a gender specialist and see a lot of trans kids, and I'm super interested in the whole boundary thing about how to help couples when they are high conflict couples, particularly trauma couples, and those boundary lines and how to support them with that. So thanks.
Mary Beth.
Hi, everyone. Mary Beth, I'm an MFT student. I've been at Wiser for about 2.5 years. I just started my practicum. I'm really enjoying it. So, yeah.
And that is super exciting, the practicum.
Yeah, it feels, I just got off the phone with my supervisor, and I had a week where I just felt like I'm in the right profession. Like it feels really exciting.
I'm playing around with the screen trying to maximize things. I was telling somebody at a workshop the other day how I had done some feedback with a particular client. Some of you guys might already know this, and it was about how he had been abandoned as a kid because of the parents separating, the immigration for both of them, and how he lived with his grandparents for a while, and then he finally showed up in the United States with them, and how it must have been really hard for him. He didn't have any memory of really how hard it was for him about being abandoned. And then lo and behold, they're out together, and he has him and his girlfriend are out together with another couple, and as they are leaving a bar, he mistakenly, they leave him behind without realizing it. And then when she goes back to get him, he's really upset, but he won't say what's going on with him. And he stays upset for the whole night. And finally, he several hours later, they're at the hotel room, and she says, "What's going on? Why are you so upset?" And he says, and then finally he blurts out, "You abandoned me. You abandoned me. I fucking hate being abandoned. My parents abandoned me." And bam, boom, explosion, understanding, compassion, connection, the trauma of it all. And I was saying how, I'm sitting there being very professional and appropriate, going, But inside I'm going, woohoo, I'm a therapist, woohoo, I kick butt, damn it, woohoo. And I did my internal little therapy dance to celebrate. And that's the kind of stuff that's just phenomenal, as supposedly professional as we are. That is some real exciting stuff. Being in the right place, feeling like you're doing the good work. Yeah, they pay me. I'm supposed to do this, but hey, that's amazing. Maybe touched a life there and made a relationship work, help make it work or deepen it. So being in the right profession, yep, cool, awesome. Steven, what's up with you, Steven?
How's it going, guys? Everything's good. My name's Steven. I'm a MFT PCC student at Weiser for a little over 2 years, and a former teacher. And I've been in my practicum for about a month and a half now, and going to see my first couple next week. So this should be pretty interesting and relative. Great timing on the seminar. Like Mary Beth, it's been exciting to kind of just get into it and apply all these things I've been learning. And I also have an interest in incorporating music into certain therapeutic interventions and kind of intertwining them on my own. And everything's been great.
Awesome. So I'm Ronald Mah. I'm a Berkeley kid who grew up on Alcatraz in Sacramento, around the block from the old Weiser site. Went to primary all-black elementary school, and then ran into people like Bobby over, like Robert over at Garfield, which I drive past all the time still, which is now Martin Luther King, and then Berkeley High, Cal, and so forth, and found Weiser in '87 as I was doing career change. When Mary Beth says being in the right place, having been an educator, that was close, and then becoming a therapist, this is really where it's supposed to be. So that's really exciting. And dealing with doing all online work because of the quarantine, and I'm closing down my office. I cleared it all out. I fell down when I was painting. I dislocated my finger. It's kind of gnarly right now. So that if you see this tape popping up, that's why. But moving on because you got to move on. Make adjustments because you got to make adjustments. It's kind of like when Steven says he has to do therapy, he's doing couples. Is that, man, couples therapy is such a crapshoot. My joke about planning is that the first mistake of planning is planning for your plan to work. Well, couples therapy, man, anything can break loose. All hell can break loose. They come in, they want to work on communication, and it turns out that there's trauma. It turns out that there's personality disorders. It turns out that there's attachment issues, abuse, child abuse, sexual abuse, all kinds of stuff. It's just like it's amazing. And some of it you find out in the phone call. Some of it you find out later on. Some of it it's kind of like a ticking time bomb. And every once in a while you do it, and it's like, oh crap, I should have known that. I should have felt and seen that coming. It's kind of like it's like perspective wise. It's like looking at something from a particular vantage point for days, for weeks, for months, for years, and then suddenly you shift to another vantage point, and all of a sudden it goes, oh, damn, what clarity from this new vantage point. This work, this is my book. I wrote it as one of my projects for Wiser when I did my doctorate. This is about couples therapy in general. It's also about domestic violence. But part of the thing is that just like Stephen's walking into a couple situation, I'm sure Anne, as someone who's done a couples therapy, which is you do couples therapy, and it's like, the phone calls, hi, interested in doing couples therapy, me and my partner, me and my spouse want to couples therapy. So what do you want to work on? Oh, we want to work on communication. We have some communication issues. It's kind of classic, ha, 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 It's kind of like there's a little bit of snow in the Arctic. Yeah, right. But then I always refrain back to them is that, well, it's usually not about communications, just about communications, but it's about the injuries. It's about the hurt and the healing from bad communication. So if it's just about communication, you could get that out of a video, out of a book. But if it's about healing, then we need to talk about that. And then you find out how deep the healing is. So some people, and I remember being a new therapist saying to myself, hey, I'm going to be a therapist, but you know what? I'm not going to work with crazy people. I'm going to work with normal neurotics. I'm not going to work with people with any drug or alcohol issues. I'm not going to work with people where there's child abuse. And that's the stupidest thing you ever said to myself. It's like, not work with child abuse history and not work with addiction issues. And it's like, damn, almost all of everything has that, right? And within that, so this is about couples therapy, but then this is about domestic violence. And there's a continuum of domestic violence what to look at. And there's an underlying issue that continues to be a big issue and a lot at stake, which is that should we even be doing couples therapy? Because there is certain kinds of domestic violence that it is so dangerous that couples therapy can be really seen as perpetuating the abuse. But if you look at abuse on a continuum, there's a lot of therapy that can be done and be appropriately done. Because especially if you look at a continuum, that there is emotional and psychological violence along a continuum that moves into physical violence, but it moves into being a batterer and habitual, what they call instrumental violence, and how dangerous that is. So there is a fuzzy line here. And there's some things that can be done over here. So Rosa is here. So Rosa, say hello to everybody. Introduce yourself again. I'm so glad because I plan to completely exploit you here and use you for most of the therapy, so forth. And you have a couple of your colleagues who are here as well. So introduce yourself, please.
Okay, so well, I'm Rosa Reinakainen, and I'm Wiser doctoral student and marriage and family therapist, and I've been in the field for over 20 years, and I really actually started the kind of deeper counseling kind of work in domestic violence shelters, and I've worked with children and families and adults. I've worked with the survivors of domestic violence, and I've also worked with offenders and groups. So this has been, and I've had like a family history of domestic violence. So I've just been working with this issue for really my whole life. And so yeah, that's me and this issue. And Ronald, I'm really happy you're doing this, and it's nice to see everybody here.
As with Rosa and everybody, your background, your experience, I really would appreciate if you interject and contribute as much as possible. Because you know how it is when you go to a workshop and some big head up there is pontificating like crazy, and you don't even relate to it. Mm-hmm. So you make it relate to you, bring up the concerns, bring up the issues.
Oh, I had couple more things to say. Just yeah. Sorry, Ronald.
Please.
Well, specifically, I think this is a very big issue. I don't know if you've said this already, but during COVID, because people are at home and they're really, really stressed out. So there's like more conflict I'm seeing in couples. I know my colleagues are seeing that. Also, just specific to the queer community and domestic violence, it's sort of an unexplored area. in many ways. And so just access to services for queer, trans, non-binary people, I think is really important as well. So go ahead, Ronald.
Cool.
Sorry.
Awesome. Thank you. I just realized I'm going to talk about something that I haven't time to talk about because it all kind of all fits in. So we're looking at therapy. We're looking at why we're doing therapy and how we're doing therapy with couples. And we think, it's going to be simple. And I'm going to break it down to why it sometimes can be really simple. So what's normal, and also among the principles we're going to talk about is individual therapy within couples therapy. I think individual therapy within couples therapy is amazing. And I think that individual work is probably best done in couples therapy, because what happens is that, a client can see me and they can talk about, I do this, I do that, I have this issue and everything else, but that's not the real world. You can do the countertransference and transference, and they can play things out, including attachment with you. But the real world is out there. And the really big real world is their spouse, their partner, they're living with, and they're going to be triggered by them. They're going to be triggered by them. So, and it's also, that's the point where there's enough of a crisis that they're truly invested. So you could do amazing work in individual therapy in that. And also what also happens, which is I think a really big deal, is that this whole idea of watching and seeing. Because if I'm working with somebody, okay, so we got Bobby and Tori sitting there. So if I'm working with Tori about something, and then I help Tori get to this place, she discovers it. There's Bobby there, available to understand and be compassionate. And then Bobby can basically go, oh my goodness, I thought she was just crazy, Instead, it's like, this comes from something really deep and profound. And there's a level of understanding, but more importantly, a level of compassion. And UCA, understanding, compassion, and acceptance, those three parts of it. What that understanding is, that's why she does that. That's why he does that, and compassion. And then the acceptance, which moves you forward. That's remarkable in couples therapy, And there's also another aspect of it, which is, we'll talk about more a little bit later on when we talk about dealing with someone who's narcissistic, which is that you get to be a witness. I'll do real quickly here is that, so I'm working with a client, and this guy I'm thinking about, really narcissistic, and he's something of a butt, and he's doing a little superiority thing, and he's being dismissive of me, like narcissists will do. And then I bring myself into the therapy and say, I just experienced what I did this, I did that, and then you said that, what felt really dismissive, and that doesn't feel very nice, But rather than asking him about what just happened, as soon as I asked him that, I said, yeah, it feels very dismissive. And I turned to the spouse and says, does this happen to you? And basically, they go, yeah, hallelujah, I got a witness to this. Or I see them do it between each other, and I comment on it, and the third person as the witness is powerful. That's individual work within the couple's dynamic, which I think is amazing. It's positive. Okay, now there's also this something about assessment and diagnosis, which is really important. And Stephen especially, and Mary Beth, because you are starting your practicums and so forth. Slow yourself down, and Alex will be there really soon. And I know Alex is doing some volunteer stuff already. Slow yourself down and don't be a therapist. Slow yourself down and don't be a therapist. Don't get caught up on doing something. Just sit there and listen. Sit there and absorb. There's all kinds of communication coming to you in the body language, in the tone, on the phone call. If it was in person in the waiting room, just sit there. I see people all the time. They're so caught up on trying to do something right away, be therapeutic right away, that they don't take in. So there's a principle here which comes from a couple's dynamic relationship that I had, interaction with this one particular couple. He had been an alcoholic, or he was an alcoholic. 10 years, serious drinking, kind of bugged out, and she had continued in the family, continued doing what she needed to do in terms of taking care of the kids, take job and everything else. She just carried on and dealt with his alcoholism, and but he's a really good guy. There's issues and traumas that caused him to self-medicate with alcohol. We kind of figured out that he basically pulled his head out of the bottle, pulled his head out of his ass, and decided to be a real person again and healthy. And he was trying really, really hard. And then in the session, we're talking about stuff. And she mentioned something about, and I do this hobby, scrapbooking and stuff. And it's really fun. He looks at her in a big surprise. He goes, really? You like scrapbooking? And she goes, yeah, I've been doing it for the last 5 years. Haven't you been paying any damn attention? He goes, oh, and he's all chagrined and shamed about it all, And then with all that, we do a lot of work, and the therapy actually goes really well because they're great couple. And then at the very last session, we're about to leave, I ask her, hey, does he get you yet? And she goes, no, not really. And he goes, oh, crap, says, been paying all this money. Ronald's in my ass every week, all this time in agony. And she still don't know if I get her. And then I ask her, can you tell he's trying to get you? And she starts to smile. She goes, yeah, I can tell he's trying to get me. And then I ask, can you tell he wants to get you? And she gets this really big smile on her face and says, yeah, I can tell he wants to get me. And that's pretty fucking amazing compared to what it was before. You cannot get somebody unless you're trying. And you're not going to be trying unless you want to. And that's the paying attention. I don't know how many times I've told parents, shut up, stand down, stop it. Stop trying to make your kid be what you want them to be, what you think they should be, and just pay attention to what's going on within them, mentally, emotionally, spiritually, sexually, in any ways. Because when you're trying, because you know what happens? Sometimes I do interventions and I give feedback, and I really want to, I'm really trying, but I'm off. The intervention, the insight's not quite right. But the really cool thing is that if the client knows that I want to and that I'm trying, I get credit for that. I get credit for wanting and trying. And the beauty of therapy is that you don't have to be that precise. I put out something, if I'm anywhere in the neighborhood, they'll correct me. But in correcting me, they find their voice, they find their truth. And that's, and then it's not only like, and you probably extend that this metaphor even beyond that. Does your client get themselves? Are they trying to get themselves? Do they want to get themselves? Or are they so busy condemning themselves instead? That's that paying attention. That's why, like for any kind of therapy, couples therapy especially, but also domestic violence oriented therapy, is that there's some really good couples therapy out there. There's actually some very good techniques and interventions and series of domestic violence. But you can't just drop it on them, because that's not doing assessment. That's not paying attention to who they are. So I'm gonna give you another phrase as to bring us toward this, okay? And it's a simple phrase or statement, which is, it must mean. It must mean is deterministic. That's how it has to be, and it speaks of gloom and doom. And along with in cross-cultural work, it's used there too, which is determinism. Is that's how it is. That's how it is. It's a black thing. It's a Chinese thing. It's a gay thing. It's a dyke thing. It's a Kansas thing. It's a thing. Basically, it's been determined from ahead of time. In other words, it can't change. And then along with relativism is that it's all relative. You don't understand because you're not a Chinese person who grew up in South Berkeley. You're not a white male. You're not a female. You're not this. You're not that. You didn't grow up in the '60s in Berkeley like me and Bobby. So you don't know what it's like. And that's relativism. Well, with relativism and determinism, it becomes a therapeutic shutout. Basically, you can't touch this because it's been predetermined and you can't relate to me. It must mean becomes you're really stuck. Now, the way out of that is a practical functional assessment, which is, so how does that work for you? If that's been predetermined, because that's what the Smith family or the Ibarra family does, or that's what men where I grew up do, or that's how this community does stuff, and you don't understand because you didn't grow up there. The key question is, how does that work for you on your third divorce with the violence between you? How does that work for you? So basically, you shift from this determinism and relativism to going to a functional analysis. Does this work for you? Because if it's working for you, you wouldn't be in therapy. So it's very functional. and it's non-judgmental, and it's up to them to determine whether it's functional or not. You know, like I've worked with couples that are very traditional, male-female, patriarchy and so forth, and it works for them. It's not my, I have a larger social commentary on that, but it's their personal choice that it works for them. If it's not working for them, then that's an issue. And if it's not working for both of them, it's not working for them. But that question, the change from it must mean to it might mean, is a huge change. It's a huge change, because it must mean it's deterministic. There's no choice. You're doomed. You're stuck. But it might mean, and once you have it might means there is leverage. There's an opening for intervention, for questions. So you could liken this to strategic family therapy, which is breaking the cycle. And the cycle is you're stuck and you can't do anything. But it might mean allows for exploration. What about this? What about that? What if it means this instead? Teenagers raging. It must mean the teenager's out of control. Well, it might mean the teenager's out of control. It might mean the teenager's scared to death of the life transitions. Maybe it means the teenager has anxiety because their sexual orientation is not being honored, and anger is a way to do. The other thing that we're going to look at, and by the way, we'll talk about that next. So this was a little introduction, which is this is borrowed from Gottman. Gottman got some good stuff. It's borrowed from Gottman, so it's derivative of the four horsemen of the apocalypse. But I broke it down in this other way, and it's actually a useful way to look at couples therapy. I often use this at the beginning of couples therapy, but it can be a way to do assessment as well in terms of the level of violence to it. So basically, the first one is comment. You know, the comment being, "Oh, we never go out anymore." Oh, well, that's just a comment, right? Just a comment. Oh, hell no, it's not just a comment. It's a comment. And if you love me, care for me, respect me, you will know that there's something that's important to me, and you will do something about it. If you don't do it, you're a lying sack of crap. And my mother was right about you in the first place. You know, comment. Innocent comment, not innocent comment. Then you cross the line. What the line do you cross? You complain. Man, I miss going out. We used to go out a lot. We don't go out anymore. What's the line that's crossed? Before, it was just a comment. Now there's negativity. Now there's distress. Now there's a need that's been crossed over. Okay? So complaining. Same basic rule though. If you love me, care for, respect me, attend to me, you will do something about it. If not, you're a jerk. Or you're not as lovely as I thought you were. And then you cross another line. You haven't been taking me out. You used to be more fun and used to like taking us out to do something. Comment to complain, the line that's crossed is negativity. Complain to criticize, the line that's crossed is first person, second person, directive. There's an accusation to a specific person, okay? Now at this point, it's all kind of lightweight stuff. In fact, at this point, if somebody calls you, and they won't ever call you for couples therapy at this point, it is just communications work. It's about owning yourself, having a voice, and everything else. It's a piece of cake. But they're not going to come to therapy for that. They could read a book about that. What happens is the next big line that's crossed over into contempt is, you're an ass that you don't take me out anymore. What's wrong with you? You're being mean. You're being cold. And what crosses over from comment plus negativity to criticize to complain to cross to direct to you is contempt. Is now with contempt, injuries happen. Injuries start to develop. And there are a few self-aware couples who at this particular point realize this is ugly and scary, and we better start couples therapy. So they come to couples therapy as they're starting to hurt each other, but before the hurting becomes crippling, calcifying, and part of their whole system. And it's like, oh, piece of cake, easy to heal, relatively speaking. You teach communication stuff, you deal with the hurt. I felt bad when you did this. Can you say this to me this way? This feels more honoring, feels more respect. All the different things you can do with that. The problem is some people stay in the state of contempt, where they injure each other for decades, years and decades, you know, and becomes the hurt becomes injuries, becomes crippling, ascends to the relationship, made more severe. And then 20, 30 years down the line, they come to therapy and says, oh my God, I wish I had you 30 years ago. This would have been easy 30 years ago. But now with the crippling nature of the contempt. Okay, now with contempt, when you're hurting somebody, you're not being the nicest person in the world, for sure. You know, so no matter how much you could be, you know, try to ignore that. So how do you justify that? You justify that by crossing over to the next line. And the next line is becoming defensive. What line is being crossed there? You're giving up responsibility. You're giving up responsibility. Here is a major crossing, because if you don't take responsibility, and I had a supervisor had a wonderful, wonderful line about responsibility, not blame, shame, or fault, or guilt, because guilt is committing a negative act. Blame, shame, and fault is at the core of you. You're messed up. Responsibility is respondability, the ability to respond. It's power and control. It's choice. It's mastery. You know, it's all those important things. In being defensive, you give that up. So, and this is where there's a significant crossing into domestic violence. Okay, and excuse my language, but this is how I speak, especially in therapy. But it's like this. The language is, if she wasn't such a fucking bitch, she wouldn't have gotten hit. If she wasn't such a fucking bitch, she wouldn't have gotten hit. What's missing in those statements? The personal pronoun I. She was, because now if you change that language to, she did this thing, she's a fucking bitch, I got hurt, I got enraged, and I hit her. As opposed to, she's such a fucking bitch, that's how she got hit. The giving up responsibility is critical. And when you see that happening in domestic violence or emotional violence, you have a much more difficult process, okay? Because they're equating responsibility to blame and shame, you know? So to hold somebody accountable, which is a classic domestic violence and couples therapy tactic, becomes highly problematic if they understand responsibility as shame and blame, you know? So you got to break through that. That's a huge issue. And that's why it's individual work, not just couples work. That making sense to you guys? Okay. Okay. Now, at that point, some people will live in contempt and defensiveness, literally in those two stages, simultaneously or back and forth, for years and years and years, you know. And now, how do you do that? Well, some people stay in this active volatile state, and we'll talk about people who do that versus people who don't. And how do you do that? You cross this other line from defensiveness to disconnecting emotionally. In other words, I can't deal with this emotionally. I give up on the intimacy. I've given up on the love. So this is now becomes a business relationship. It's a household management and child development, child raising relationship. Or if you are in the work world, it's called, I'm just going to do my job. In other words, I won't be emotionally invested in the job. I won't be emotionally invested in my partner. I'm just going to do the job because there's a giving up of intimacy as well. You know? So this is where what Gottman calls stonewalling. We're going icy, you know. And I have a client right now who is totally, she knows she's doing that because the reason she's doing that is that if she doesn't do that, she gets enraged and she gets devastated. So she's protecting herself from the pain. Contempt and defensiveness, you're being ugly and nasty. You're also not taking responsibility. In other words, you are totally being not the person you want to be. The ideal self is being violated, you know. So how do you justify that? You got to go code, okay? Some people stay in that marriage or the relationship for a hell of a long time, you know, and the violence between them is more code violence rather than active violence. So there's a possibility somebody who's disconnected emotionally, and they might have been disconnected emotionally for years, that there might not be overt domestic violence. There's going to be, you know, kind of icy annihilation and ignoring and so forth. And then at some point it hits the fan and it becomes explosive. And that might be when they come to therapy. And then the last thing is just divorce, which is the legal version of that. And if it's your teenage knucklehead, then it's called, I can't wait till this knucklehead gets out of the house. I'm done with him. You know, same thing. Or it's called quitting a job or getting fired. Okay. So this speaks to these things, and it speaks to this other issue, which I'm going to talk about, which is that we're therapists. What do therapists do? Therapists all the time are trying to get people to assert themselves. To assert themselves, have a voice, and so forth. Assert their wants, assert their needs, assert their sexuality, assert their cultural values, and so on and so forth. You know, to own themselves. Well, on the continuum of assertion is as you assert, there's a continuum where assertion becomes aggression. In other words, sometimes to assert yourself, you need to be aggressive. And if you're not careful, as you continue that continuum from assertiveness to aggression, it can move into abuse. Assertion, aggression, abuse. Okay, now embedded in all of that possibly is anger. We'll talk more about that as well. So we want to make sure that people don't get to this abusive place. And, but at the same time, owning that sometimes you need to be aggressive. You know, I know how to be aggressive. I realize this because I'm from a family of 5 kids, 7 in the family. At the dinner table, we always talk. So I know how to interrupt people, which is not necessarily the most socially adept thing. But I listen. I try to be really respectful and everything else. But I know sometimes if I'm too passive or too quiet or too much of a good Chinese boy, I'm not going to get crap in. I'm not going to be able to say a thing, you know. So I know how to be aggressive. And that's the key there is how to be appropriately aggressive within a reasonable social context of intimacy and respect without becoming abusive, you know. And that becomes a challenge, you know. So these 4 things. So all these things I'm talking about are framings of what we're going to talk about. And I use purposely this picture of Madeline and Dirk. And the reason I did that is that to try to make them come alive as much as possible. You might have a couple that you have in mind to see, but I'm going to use these as a surrogate, so they're real people, so they feel more or less real to you. Okay, so we're going to talk, you know, first about their this continuum, but let me ask you guys, you know, we'll talk about anger in a second. So far, what are you thinking? What's stirring up? What do you think seems relevant or resonates so far in what I've been talking about? I'll bump to Rosa first. I'll ask Rosa because Rosa is you know, she didn't realize, but I tell her, she said, I'm going to become good co-facilitator at least. Bring your expertise here.
Right. I think you're right. You were just talking about how, like, assertiveness, and that you're right. We're giving clients a voice. That's our goal, is to give clients their voice, their authenticity, to be able to have them be assertive about all sorts of areas. And but also when they don't know how, when they've been kind of suppressed, sometimes that assertiveness can be demanding and, you know, kind of oppressive to others even. And so I think that kind of cycle can really happen, is like, suddenly there's a voice, you're zigging while where we were zagging, or I'm zagging while, you know, whatever, you're going this way. And so I think that's the role of the couples therapist also, to be able to see, like, past, present, future, to kind of hold a bigger time space, to be able to see, like, oh, you have not been able to do this, and now you are. So we need to make room for that. We need to do this safely. Like, how to do safe couples therapy, I think is really important in terms of this cycle. Mm-hmm. And you were talking also, I wanted to say about stonewalling, which is kind of a form of aggression, especially for people who've had any trauma or attachment issues. Just cutting off all contact emotionally, disengaging, it can leave a person in real desperation. And so then that can also increase this sort of like what looks like aggression is also the root of it is trauma.
Mm-hmm.
So anyway, that's part of it.
The last thing you said about stonewalling being aggressive, I tell this story often. I was in a group process with a bunch of therapists, and these two women, the facilitator liked people to fight because he thought people learn things from that. But these two women were they were going at it. They were like in this mean, nasty place. They were just firing it. They're sitting next to me. And all of a sudden, the woman who's sitting right next to me, she decided that she wanted to be done with it and she wanted to win. So I'm looking out there and I see the woman farther away and her face is like, ah. And this person, she turns like this, turns her back to the person like this. And I start laughing. And facilitator, what's so funny, Ronald? I says, well, they were having a fight. She decided she wanted to win and she disengaged and turned away. And she nuked her. She won. By not participating, she won. You no longer exist. You no longer matter. Classic existential question is what? If a tree falls in the forest and there's no one there to hear or see it fall, did it really matter? Well, if I feel, if I want, if I have anger and you don't notice me and I don't matter, then I don't matter. It's a complete annihilation. This calligraphy is Chinese words are two words put together. All of that. The top word is study, the bottom word is practice. And together they make up learning. Therapy is study. Reading a book is study. The practice is out there in the real world. So basically what Rosa said is that, if they haven't had experience being assertive, how do they find that place, find that way? And the bottom line is practice. Study all you want, but you've got to practice. And there's a little bit of practicing in therapy, but that's not the real world, which is why I like couples therapy, where I can do individual work. They have to practice right there, and I get to see them practice. And there's a real person there who's going to hear them or not hear them, So study and practice is huge issue. You could, I could put some of these things on a chat later on. You take them, or you can find them on the website. Other people, thoughts about this assertiveness, aggression, or just how I sort of started introducing these things? Thoughts from your world? Yeah, Anne.
I'll just throw out one thing that's a quote I've always liked. A local sex therapist, Marty Klein, Dr. Marty Klein, one of the things he says is he'll tell couples, he'll say, you say communication is the problem. He said, I hear that you are communicating just fine. You just don't like what you're hearing, which that's where you start, right?
Right. Well, and there's this communication that is ostensibly the more interesting people are the people who basically say in a nice, quiet, calm tone, "F you," the covert aggression, which is very interesting, and it's important to call people on that. Other thoughts about this so far? A couple other things, because since I use this as an initial assessment sometimes, is that I'll tell them about the 4 C's and the 3 Ds, and then I'll ask the couple, where are each of you? And they'll describe themselves either being in a stage or maybe transitioning from contempt to defensiveness or defensiveness to disconnecting or something like that. And what's really interesting at times is that you'll find somebody who is surprised and shocked that their partner is at a more devolved stage. Like they think that they're both in contempt, but then they find out that their partner is actually starting to disconnect, and they're in shock. And that is in of itself revealing. And also, when someone's out of sync like that, the initial strategy is take the person who's more devolved and bring them back to where the other person is. So if someone's disconnected, the other person is being defensive, then you got to get the one who's disconnected back to the lesser stage. So you can't jump, and so you do that way. But also, since this is a de-evolution of the relationship, the evolution relationship is taking it backwards. So people who are disconnected emotionally, you have to find out if they're willing to connect emotionally again, which is to risk and experience being hurt again. You have to be very blunt with that. I think you should be blunt with that. You will hurt each other some more. And I understand why you won't want to do it. That's why you disconnect it, because it's so painful. But that's what it takes. If you decide that you can't do that, then you'll stay there or you'll move on. But that's what it's going to take. And then if someone's defensive, they're not taking responsibility. You got to get them to take responsibility. If someone is in contempt and they're injured, they're hurting each other, or they have wounds, then they have to get experience in therapy and in life where they are healing and not hurting each other. The entitlement to hurt, and that's a big deal. And that's a big part of domestic violence, is that entitlement to hurt. And if somebody is criticizing, it's like, then you got to get them to learn how to complain without criticizing. If they're complaining, to get them to comment. Basically, as you devolve, these also give a model to go that way as well, which also fits into the domestic violence work as well. And sometimes, like with any of my clients, I might look at it and say, no, you guys shouldn't be together. I'm thinking about it, you guys shouldn't be together. You don't even like each other. I don't like either one of you. I can't stand either one of you. I don't say why you're doing this. And I've only said that a couple of times to a couple of pair of clients, because and in some ways it was a paradoxical intervention. That you've spent the past several months, each of you, going on telling me how horrible the other person is. Well, at this point, I believe you. I believe that's exactly what you feel. So I don't know why the hell you're together. You clearly don't even like each other. Maybe there was some lust and some love, but right now you hate each other. So I don't get it. And they left therapy. A couple of years later, they came back together. I said, "What the hell's going on? You guys are so, They said, "Well, because we thought about the kids, this and that, and we tried together, and they want to work on something with kids." I go, "Okay, your call." And a couple of years later, I saw her at the mall walking with some other guy. A lot of times you're not wrong. It's just the timing of it all. But I just gave them the best I could give them. So now we got anger. Okay. How angry? How does each aggress? So this is a fundamental question, which has to do with any therapy, but also, especially as it leads to domestic violence, is that, and the questions are, how do you, in their conversation with you, they tell you how they fight. They tell you how they aggress. Now, that fits into another a process of doing therapy, is that sometimes people ask me, how long does therapy last? And what does it take? And I go, I don't know. It took you this many years to get this screwed up. I don't know how long it's going to take to fix you, whatever. But if they want something a little bit more academic sounding, I say, well, first thing we need to do is figure out what your process is that doesn't work. Then we need to figure out where it came from and how it developed. And then we'll see if we can change the process between the two of you. And then if you can change the process, then a lot of therapy will be about changing it. And then the last part of therapy is about how to maintain that process, problem solve it. So we'll get to that stage, later. But right now, we need to figure out what's going on and where it came from, how it developed. So the question is, so how do you fight? And a lot of times people don't fight well. They fight nasty. They do the silent treatment. They get volatile, they get insulting, and so forth. And then the family of origin, or the psychodynamic question, is, what models did you have fighting? How did your parents fight? How do your parents fight? Other versions that would be, how did they do confrontation? And then the underlying question is, how did they do conflict, and how did they do anger? How did they do anger? And sometimes the therapy is about teaching clients how to fight. Okay? Teaching parents how to fight, because they don't know how to fight. They only know how to search and destroy. Let's see, where's my other? Yeah, I'll just talk about it out loud. Is that people avoid confrontation all the time. very often. They avoid confrontation because it leads to conflict. Okay? And they avoid confrontation because it leads to conflict. They avoid conflict because it leads to pain. Pain. Okay? The problem is that confrontation also leads to four things. It leads to resolution, you resolve things. It leads to security. In other words, you set boundaries so you know things are predictable and understandable, containable. It also leads to justice, that it's fair. And through resolving things, setting good boundaries, becoming secure, and what did I say the other one was? Justice, fairness, you actually get greater intimacy. So this changes the paradigm. It changes the basic principle that fighting is bad. No, fighting gets you resolution, security, justice, and intimacy. So if you avoid it because you avoid conflict, confrontation because this conflict leads to pain, well, the rest of the trail is that only because of confrontation you get the resolution, the security, the justice, and the intimacy. Only through sometimes the confrontation that leads to conflict, you get the resolution, the security, the justice, and intimacy. And sometimes only through going through pain do you get the resolution, the intimacy, the security, and the justice, the four things. So what does therapy, couples therapy become? It becomes teaching them how to fight. And sometimes, I do that very, very aggressively at times. Someone comes into therapy and says, did you have a good fight this week? Okay. And how do you define what a good fight is? A good fight is a fight that results eventually in resolution, security, justice, and greater intimacy. And maybe some sex too afterwards. Or if on the other hand, you do that fight and you don't resolve things, boundaries become still problematic, or exclusionary or hurtful, and it doesn't feel fair, no justice, then there's a loss of intimacy. That's a bad fight, okay? And when you're doing couples therapy, and when people start talking about the fight that they almost had or the fight that they did have that had good results, that's one of those fights. Okay? So you're changing the paradigm in itself, how to have good fights, so to speak. And people really have aversion to that. So, but then a classic answer, two versions of this classic answer. This one guy, I remember, and he kind of exemplified both of them. I said, for this one guy, it's like, so how'd your parents do anger? I never saw them they didn't really do anger. How'd they do conflict? Well, I didn't really see any conflict. How'd they fight? I don't know. I never really saw them fight. Maybe they did it in the bedroom and so forth, And basically his wife starts elbowing him and said, tell Ronald. I said, tell me what? And he says, that's why I was really surprised when they got divorced when I was 12 years old. Undercover, tension without being identified, which will make you crazy when everybody tells you it's okay. Now, the other side of it is a different guy in couples therapy where he said, I don't like to fight. So why not? I said, how did your parents fight? Ugly, nasty, eviscerating, annihilating, humiliating, toxic, scary. It was just scary as hell. Scared the hell, he said he saw his dad scream at and intimidate and terrify the mother, saw the mother lash back out at him, and then him and his brothers and sisters were just sitting there or around, scared to death. And he swore that as a kid, I will never do that to my partner. I will never do that to my children. So what does he do? He does nothing. He shuts down. At which point I turned to the wife and I said, is that something? When you try to get him engaged, including arguing and fighting, when you try to get him engaged, he pulls back and shuts down. And you feel abandoned by him. You feel shut out by him, that he's rejecting you. But it actually, in some kind of screwed up way, is an act of love. Because he's trying to protect you from the rage that his father gave his mother. He's trying to protect you from the terror that he experienced as a child. It's actually an act of love because he doesn't know how to do it differently. And she's kind of like, really? And I look at him and go, isn't that true? He's kind of like totally busted. You know, oh my God, you know. And then that becomes the entry to learning how to fight, to express. Yeah, Lainey.
So how do you distinguish between fighting and a problem solving discussion when the people have different perceived needs or goals?
Right.
Because I would say, well, people don't have to fight if they know how to do collaborative problem solving. Right. But
Yeah.
it sounds like fighting is something different. So I'm wondering what that is.
Fighting is what we work with people on, and fight, and the other stuff is what they do because they don't need therapy. You know, because problem solving is just problem solving. You know, here's one way to put it: problem solving is a problem. Having enough income to pay the bills. Problem solving is getting the chores done. Okay, that's the problem. Those are the problems. Fighting is you're the problem, I'm the problem.
Okay.
Fighting is my self-esteem, your security,
Okay.
your sense of worth. Those are the problems.
Okay. So there's underlying issues
Right.
and self-esteem at stake.
Oh yeah, absolutely.
Fighting.
Right.
And most of the people that come to therapy, that's why they're there.
Right.
Otherwise, they wouldn't need to come, and
Right.
they could just have those problem solving. Just okay.
Right, and you'll see this sometimes, in a fight or argument where someone says, "Well, okay then, just take it. Just take it," which is basically, excuse my language, but a big fuck you. Here, you win. Just go ahead and do what you want to do. And then you're kind of like, I won.
Yeah.
I won. I got to do what I want, but I got this gigantic side order of contempt and hate. I didn't win. So that's why the problem is not the thing, not the money, the towels, the car or anything else. It's those other things. Carmen, welcome. Introduce yourself. Take a minute, introduce yourself, and then we'll carry on. Your microphone.
There you go.
Hi.
I was just on in a book group on anti-racism, and Anne, who's I see right in the grid here, she texted me and said you'd really like this. So she sent me the Zoom. So I'm not quite sure where I am. I just I trust her recommendations. So you'll really like this. So
are you a therapist?
Yes, I am. I'm an MFT. I'm based in Carmel in private practice. I live in Carmel Valley, and I'm only been doing teletherapy since March.
Right.
I work, I guess, a lot with couples and with intimacy, sexuality, and gender.
Cool. Well, invite you to participate as much as possible. Everybody can add to this as much as possible. Yeah.
Thanks.
Anybody else have some thoughts about the fighting aspect? Because it's a really, in some ways, it's a different paradigm. That couples therapy is to get people to not fight, as opposed to couples therapy is to get people to fight well, to fight healthy.
Fair fighting.
Yeah, fair fighting. And basically, it's like one of the things I say sometimes is, have you ever, with your partner, intimate partner, have you ever been in a not dumb fight? They're always dumb fights, because it's just the fucking dishes. But why are you fighting over them? Because there's something much more tied in, and because you don't identify it, then it becomes a dumb fight about dishes rather than about these other things that are much more profound.
I guess good fights can be the fights where there's a real issue, like you did substance abuse, or you cheated on me, or this or that. Like that's a real issue.
Or even smaller things, like I come from like an attachment place and lens, and so it's actually, I think all fights are sort of about that. Like, are you here for me? Can I be myself? Are you, or can you be yourself? Are we, are we together? Are we connected? Are we too separate? Are we too connected? It's like closeness and distance is a really big thing. And those fights are about like, you didn't call me, you didn't do this thing, which helps me feel more secure.
Right.
That's what it's usually about. And it can create huge amounts of anger and then blop into, kind of hostility because of defensiveness. If it's met with defensiveness, then there's easily gets to hostility.
Absolutely. Other people got some thoughts about that? I did find it. Yeah. It's a confrontation. So we're teaching people how to confront, and they're avoidant. And there's reasons why not. Because it might have been hella dangerous to confront when you're growing up. All those attachment issues and so forth. I mean, you could even, you could shift this not just to interpersonal, but intrapersonal. Do I want to confront my feeling different? Do I want to confront my arrogance? Do I want to confront my sexuality? Do I want to confront my sense of humiliation, my shame? That's some scary stuff. So if you look at basically interpersonal therapy, relationship stuff, but you also look at intra and the concept of within yourself, you have these aspects of shame, of need, of whatever else. Those are confronting things too, and there's pain. That's the tough stuff to deal with. Okay. So, yeah, Alex.
It's also true that in a good fight, you have to go through pain because there's pain already there, but you don't, in a healthy fight, you don't create more pain. Is that true?
Probably not.
Okay.
Well, first of all, you don't have to have a good, it seems to be intrinsic that a good fight, there's energy exerted. And pain can happen. But then, so is exercising. Exercising causes pain, causes stress. You actually injure the muscles and they get stronger. So these are relationship muscles. And in the process, sometimes there's pain. Sometimes you hurt each other telling the truth. If I'm in an intimate relationship with you and I got to tell you something that you don't want to hear, that's going to be painful for you, but it's necessary because it causes me distress. So I wouldn't be so, exclusive about that. And remember, it's the classic discussion about pain. Pain's a warning. My finger right now, it hurts. I dislocated it. This bone was sitting on top of that bone. That joint I had to pop it out. And last 2 days, I was doing physical work, and it hurt. And the pain was telling me, you shouldn't be doing this, or you need to be way more careful about, how you're doing it. Emotional and psychological pain is telling you the same thing. Your psyche's at risk. Your ego's at risk. Your attachment, security, things like that are at risk, and it hurts. And do you do too much? Or here's a nice pain thing, is that you meet this person who you think is attractive, and they do something that's disrespectful or rejecting. Is that should I go back for more? Or the pain says, no, I shouldn't do this again. It makes sense. So pain's a signal. And that's where, so fundamentally in therapy, people come and ask for something that's crazy and unreasonable, which is that I have anxiety, I have depression, I have stress. Help me get rid of one of those things. Help me get rid of the anxiety, get rid of the depression, get rid of the stress, then I'll be fine. And it's like, you buy into that, you're in trouble. Because those don't go away. So what you learn to do is to manage them well enough to do it anyway. Do it anyway is one of my favorite therapeutic interventions. You're scared, do it anyway. You're stressed, do it anyway. And how do you get yourself to be able to do it anyway? Do it with stress. Do it with anxiety. I've shut down my office, okay? That's stressful, is a loss. That's a whole other issue about loss, but I'm doing it anyway because I need to. You know, I'm doing it with doubt and everything else. And that's, you know, how do you do it without anxiety, without depression, without stress? It's called drugs. It's called alcohol. It's called wild sexual escapades, you know, gambling and stuff, self-medicating, blocking out, you know, chemical disassociation, you know. So that's the problem. So how did they fight? How did they aggress? How did they assert? You know, that's the question you want to ask them, and the models of that, you know. And then sometimes, and with a couple, it's also, what's also really cool is that not only you can ask about that, but you could ask about you could ask the partner, what have you seen your partner do? Does that make sense to you? You know, because sometimes they will lie to you, or they have their own perspective. You know, how do you see their family, how they fight? How do you see them do their interactions and so forth? And some of it is a very, you know, it's like very much within a family dynamic, and sometimes it has very significant cultural aspects. You know, in terms of a particular culture does confrontation, does fighting, you know, a certain way. So and there's one couple, so one person's dominant, and the other person's submissive. In other words, being submissive, they're actually passive aggressive. The key thing about passive aggressive, it is aggressive, you know, but it has plausible deniability. It's a sneaky fuck you, you know. But then you look at that and say, okay, is that individual or is that cultural? Because in some cultures, especially the patriarchal cultures, is that male dominance and female submissiveness is part of the cultural pattern, you know. But then, is that part of the cultural pattern, or has that been accentuated by the narcissism of one of the others, or the attachment issues of one of the others? You know, so within a cultural framework, you want to look at it too. Certainly within gender differences, the genders is how you manifest that, and in same-sex couples, you'll get a layer of culture depending on where people come from, depending on how internalized, whether it's two women or two men, whether to the degree that those two guys, how much each of them or either of them has internalized patriarchal models anyway, or and the two women, what they've internalized, or whatever variety of backgrounds and experiences. It could be individual. You know, one of the things is, you know, in terms of understanding stereotypes, is understand stereotypes well enough so you don't just drop it on people, but you know I'm gonna check this out. But also there's individual relevance that you got to figure out as well. So how do they fight? You know, how is it expressed? And then now here's my Dirk and Madeline. You know, where Dirk calls her Mad Madeline. Obviously, Madeline calls him Dirk the Jerk. They had prior therapy. So you think about, here's a couple that comes in therapy, and it failed. It didn't work. Well, because they didn't look at the aggression. They did communications work. You know, they did communications work, and learned I statements, and they didn't assess along a continuum of assertion, abuse, assertion, aggression. They didn't assert that, you know. And the core issues, you know, probably were about emotional, psychological aggression or abuse. Okay. Now, anger. Why is anger such a big deal? Actually, this last week, Saturday, I did a training for a CAMF, California Association of Marriage Family Therapist chapter, and I talked about how I feigned anger really aggressively at this one particular couple. And one of the participants basically strongly disagreed with me and said she doesn't do anger. She doesn't allow anger to come into the therapy room, you know? And I was thinking to myself, what the hell is, I couldn't say it out loud because I was just being professional, but it's like, what is this? We want to honor people's humanity, all their emotions except anger. That's dumb. That's stupid. That does not honor humanity. And what does that almost certainly imply? It's like, you should come to see me in therapy, because it's like, you clearly have a really adverse experience with anger. where it was horrible for you. So you decide to eliminate that part of your humanity. And here she was, probably pissed at me to talk about anger, you know? And it's like, this is, you know, it was through the screen, but I smell something here. There's something stinks here, you know? She was pissed, you know? And it's like, see, but see, the reason why, now, anger is dangerous because it has to do with high emotional arousal, okay? And with high emotional arousal, people just get going, okay? One of the principles about theories about brain arousal, high emotional arousal is just about impossible to stop it. Just about impossible to stop it. It's like my analogy is like, you know, there's a runaway stagecoach, bang, 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 the driver gets shot. Everybody's in the stage going, ah, we're gonna die, we're gonna die. The horses are careening down this mountain path. It's gonna go careening off the side of the mountain at any particular second, you know. So what happens? The cowboy, cowgirl comes riding up, joins the energy, joins the direction of the stagecoach, joins the anger, joins the arousal, literally reaches over or literally jumps onto the horse's back. And once they've joined, they slow it down and veer it onto a safer path. Because if the cowboy or cowgirl stops in front of the horses and say, stop, stop, stagecoach roadkill, you're gonna be smeared, you know. And that's why as a therapist, when you see there's if you have issues with anger and you're afraid of anger and you try to stop it, you'll be therapeutic roadkill. You'll get smeared, you know. So now, I'll give you a couple examples. And this is my bad potty language in working with teenagers, but it's hilarious. 2 examples. One has to do with high arousal. It's not just anger. The first one's anger. So my teenager comes in. He's late for the session, about 10 minutes late. And he goes, no, drops this piece of paper in my lap as he goes to sit down. He's like, all like that. I go, what you got there? I go, huh? You got a traffic citation. Hey, you got a ticket. You got cited for driving without a license. You got a ticket for driving without insurance. You got a citation for driving with a loud stereo on. So there's a lot of things I could have done. But he was in a high state of arousal, right? So I laughed at him. You're so fucking stupid. You're so stupid. He goes, what? I said, you're so stupid. What? I played it along for those. And then finally I go, you're so stupid. You're driving without a license. You're driving without insurance. And you're driving with hell of a loud stereo so he could catch you and notice that you're driving without a license and driving without insurance. You're so stupid. He goes, oh, fuck you, Ronald. And then he smiled. Because the high emotional arousal cannot be stopped or blocked, but it can be diverted. And humor in this particular case diverted it, you know. And then I teased him a little bit more. He told me to go fuck myself a few more times. And then we dealt with him making choices. You know, because in that state of high arousal, he couldn't do that. Okay? Now the other one, which is has to do with sadness, because sadness could be it as well. Also joy, but this is sadness. Some of you guys heard me tell the story before. So it's one of my favorites. I work with this woman. She has horrific life experiences, addictions, bad relationships, lots of stuff going on in her life, and everything's going to hell to her. So I walk out to the waiting room, and there she is. She's all huddled up like this in a little ball, and tears are running down her face, and her mascara is all messed up. She looks like hell. You know, I said, whoa. I go, go ahead. So she's going into the waiting room. I'm walking behind her, body's all slumped and dragging and everything else. I'm walking behind her. I don't know what the hell I'm going to do. You know, because she's like so messed up already. So she sits down, she looks up at me, and I don't know what got into me, but it came out. I looked at her and I go, hey, you started without me. And then she goes, ah! She starts laughing, hiccuping and everything else. She couldn't even talk for another minute or so. She was laughing so hard. And then we started talking about her life. You know. Now, sometimes The arousal is anger or depression or anxiety. Humor could be a switch. Sometimes if anger is the arousal and you don't use humor, getting somebody to be sad is a shift. Getting somebody who's steeped in sadness, getting them to be angry is a shift. And you shift. And until you shift, because that's not invalidating where they're at, but it's getting them out of that runaway stagecoach, emotional runaway stagecoach. Okay? So these principles about arousal will also apply, obviously, to domestic violence in terms of somebody being in an aroused state. So part of it is like, in that place of arousal, you got to remember two things about anger. Anger is a secondary emotion. And it's a secondary emotion, and it's an empowering emotion. The secondary emotions, the primary emotions are sadness, depression, anxiety, fear, pain, loss, hurt, those things. And all those feelings, which is why people come to therapy, are vulnerable feelings. And in that place of vulnerability, people feel disempowered. And anger is empowering. Hell with this crap. That asshole. The government. The boss. Whatever else. Punch him in the face. Whatever. It's empowering. And it gives people energy and courage to empower themselves. So when you tell somebody don't be angry, you take away their power. Because otherwise they're scared. That becomes the challenge of domestic violence therapy, is that you want to get them to be sane, healthy, and productive, but you don't want to take away their power. So that's why anger management stuff with domestic violence works fine and well enough for people who are at the lower level of anger, frustration. But if the anger is deeply embedded because it deals with deeper vulnerabilities, deeper issues, then you're telling them, stop doing that, don't be angry, don't express that way, give up your power. Have none. Totally, absolutely, we're talking about don't do it that way by beating on that partner of yours, by humiliating that partner of yours or controlling or whatever else. Absolutely. But it's like a tea kettle. If a tea kettle is boiling, and the steam has to come out somewhere. But if you block the tea kettle, what's going to happen? Block that spout, it's going to explode at some point.
Wow.
So actually, that's one way to look at domestic violence, is that sometimes it's people trying to be good and actually being good. And they're holding it and holding it and holding it, but they don't have ways to be angry, to be productive, or anger, which empowers them to take care of themselves, has been off the chart, not available, and those deeper pains become more and more, they germinate, they fester, become explosive. Somebody had a question or comment? So
yeah, I'll say a few things.
Yeah.
Okay, so from what I know of in Gottman's research, he found that once people get, he calls it flooded, flooded with those kind of high emotions, that they don't have ability to do any kind of problem solving. And from his research, because what he'd do when people were in the lab and they're hooked up to machines and he'd see, it's a lot of fun to see that if anyone wants to see it. It's on a film called The Love Lab, and it's very entertaining, and it's actually watching couples. And so he found, like, through testing, because what he'd do is, like, he'd stop the fight and he'd say, oh, sorry, the equipment's broken, so we need you to stop right now. And so through this research, they found out it takes 20 minutes for people's blood pressure to come back down, to get back to normal, where they can actually have a rational discussion. Right. So that's one of the things that, in his work, that's what he tries to teach couples to figure that out, and then to take responsibility for their emotions and take a break when they get flooded. And I have a friend who was arrested and had to go through anger management training. when he was young. He was 19, and that's what he learned to do. And that's what they taught everybody in the program, Men Overcoming Violence, which is in San Francisco, is that when they start feeling triggered, that they need to just get out, just stop the interaction. Mm-hmm. And so I'm trying to reconcile this with what you're saying about let them just be angry. But it sounds like what you're actually doing is that you're interrupting the pattern. It reminds me of Tony Robbins when there was some woman on stage crying, and he kept pouring a glass of water on her head. And then she's like, what are you doing here? And he called that a pattern interrupt. So, right. You're saying ride with the anger, but I'm kind of seeing you kind of interrupt it, but doing something to get them away from that. So anyway, those are the things going through my head.
There's a key word that you use that's very telling.
Yeah.
About let them be angry. You don't have any control. I don't have any control of being angry or not being angry. Nobody does. My toughest non-intervention is that when some guy sits in therapy and says, "I don't let myself get angry," I'd hold on to my chair real tight because I want to run over, kick him in the knee. Kick him in the knee and go, "Okay, show me how you don't get angry." No, you have no choice. The choice is how you express it.
Right.
Where you direct it. And that's what we're talking about. And also at a point of high arousal, it's the redirection rather than the stopping. So,
so when you're on a stagecoach, you're riding next to him, and then you jump on, and then you ride with it, and you redirect it.
You redirect it, and you redirect it different ways. You can slow it down, you can interject. Okay. So one of the things I've done is like, okay, I use an example. Let me use it now because there's a certain fluidity to what we're doing here. So I'm doing couples therapy, and this tiny woman, and literally tiny, she's like barely 5 feet tall. I'm sure she's well under 100 pounds. Okay, and she's sitting in the chair over there. I can still remember her there, and her husband's like 6'2", solid 220 pounds, and he's mad at her. And he's screaming at her, "You fucking bitch." Screaming at her, top of her voice and everything else. And she's sitting there, and she's like this. She's fetal, barely there because she's so tiny, and she's literally shaking. Okay? Now, this is also one of the big issues in couples therapy, is when couples therapy, in general, but especially domestic violence, you as a therapist are the one and only hope that something will be different. So you got to do something. Because if I don't do something, then she feels just as unprotected as she was before, and maybe even worse so. Okay? So I got to do something. But here's this guy raging at her. So what do? I join him. But I join him with anger. And I cuss him out.
Uh-huh.
I cuss him out a particular way. And it's pretty profane. My full potty mouth comes in, and I said to him, "Fuck this shit. Fuck her. You're telling me that she could be so fucked up that you become this fucking asshole, that somehow it's okay for you to terrorize your wife? Is that who the fuck you want to be as a husband, as a partner, that you can drop into and betray yourself and become this ugly motherfucker who scares this tiny ass woman? Fuck her. She ain't important enough for you to be such an asshole, unless you've already decided that being a fucking asshole is who." Okay? And he stopped. But I joined him in his anger. But you're like, metaphorically on the stagecoach, there's a different take.
You were also mirroring his behavior.
I was mirroring, but also going this other place. And there's this principle of the ideal self and the real self.
Uh-huh.
The ideal self is who I want to be, who I think I should be. The real self is what I do. Whenever the ideal self is honorable and makes sense, then the real self just needs to learn how to do it. Therapy becomes coaching, counseling, that we guide people to the skills and so forth. But sometimes the ideal self is screwed up, unreasonable, crazy, to be perfect, to not let anybody get mad at me. all those different things. In that, or to please the unpleasable father figure. In that particular case, that ideal self is too warped, and the real self can never live up to it. Hence, the stress that needs to bring to therapy. But what you do when somebody has an ideal, well, what I did there was I invoked and evoked the ideal self. I defined for him that his ideal self was somebody who would not descend into the depths of anger and nastiness, that nobody, including his fucking wife, was worth it for him to betray himself. So I took it off of her. Remember? She was such a fucking bitch, she got herself yelled at. I changed that to, she was a fucking bitch. I was hurt, I was angry. I chose to descend and be this other person that I don't want to be. I changed it to that. And he stopped. Okay? He stopped because of that. So I joined the anger. Now, I got a good potty mouth. You know, Bobby knows I grew up in Berkeley. Berkeley, you know, everybody, we're multilingual over there. You know, and the other thing, checking with her later on, I asked her about that. I said, that must have been really scary for you. And she said, you know, it was a relief. Because I realized that something could be done. Yeah. You know, and I felt safer because of that. It was a hairy ass situation. And it was something obviously I didn't plan. It was in the moment. It was like, here I see this huge guy, bigger than me, screaming at this tiny woman. And she's shaking. I mean, she's actually shaking. Her whole body's shaking. You know, tears and everything else. And like, what the fuck am I supposed to do? Well, I figured out what to do.
Yeah.
You know,
well,
and now conceptually, see, this is the thing about as therapy or a lot of processes. All the stuff we're doing now, we're doing ahead of time conceptually. But like great art, great art happens in the moment. Yeah. And great art comes from desperation as well.
I'm wondering if a female therapist could have done that to a guy, because that seems to me like a
Totally.
Kind of. Could you have?
Oh, Rosa.
Totally.
Yeah.
Yeah.
Oh yeah. I ran domestic violence offender groups that with all the dudes, you know, right. Yeah. You kind of have to, if you're AFA, if you're assigned female at birth, you kind of have to like get bigger and, you know, use your power as much power, you know,
that's
match their energy.
That is, if the guy is kind of a sexist, and that's kind of part of what's feeding into it, and then here you are, another woman that's threatening him.
Well,
but it sounds like you can just join in with it, and it's okay.
They
respect the language they respect. That's the language they respect. Okay.
I'm sorry. See, that's the theory I just put out. You invoke and evoke his ideal self.
Right. Yeah.
So you're a big ass motherfucker.
Right.
Big ass 6'4", 300-pound trucker motherfucker. And you don't take shit from nobody, you know, and you have your values and stuff. Well, you piece of shit motherfucker.
Yeah.
This is who you are, that you have to be intimidating to people, you chicken shit little asshole. You know, if you're this big and bad, you could tolerate this shit. You can handle this. Instead, you got to go aggressive. You know, like you're taking on a pack of bikers. What the fuck? That's bullshit. You know, so that's now. As you ask that question, because I've heard that a lot of times. People say, you know, well, you do that because you're a guy. I'm 5'9". I'm not huge. You know, I weigh less because I've actually lost weight during the virus. You know, because I'm not going out to eat. But sometimes when there's a little girl or a little boy or a woman in a sad place, difficult place, my body changes, my tone changes. And what's that? Is that being more feminine? Or like when Rosa says, you gotta get bigger, I get to that other place that's kinder, sweeter, gentler. Because I own and ran preschools and daycares. You know, I've held toddlers who were freaking out. You know, I can do that too. You know what? Because that's that definition of male female dichotomy, because it's a spectrum, which is that it's really more about everybody might have some intrinsic genetic inheritance and so forth, but it also has to do with what you accentuate, what's been validated, what's been supported, what you practice.
Yeah.
You know, and the practice of it is I could be extremely gentle and kind. And workshop wise, I always sound so authoritative. But in therapy, it depends. Sometimes I don't say shit in therapy because I don't need to, because someone's processing like crazy, and I just like keep out of the way. You know, maybe have sometimes I've done therapy, I go, damn, that was a whole hour of therapy. I think I spent did I even spend 5 minutes saying anything that whole time? Because all you need to do is be the receptacle, the air, it depends, so it's kind of the same thing. But it really does have to do with, but it goes back to, recognizing, the arousal, recognizing and honoring the arousal. Because now in that arousal, when I was challenging him, I also was doing some psychoeducation, which is that I was telling him, you get so mad, so hurt that you become this angry person, and it's not who you want to be. So I'm actually talking to him about with all the fucks that were in there, I'm actually telling him about his process, but in his angry language. There is a joining of it. Yeah, and it does take practice. And think about it, I never would have even predicted that I would do something like that. But now that I've done it, see, and this is the other thing I said about the artistic part of it. In a place of desperation, when you're back against the wall, sometimes you're creative. Sometimes you do something that's brilliant. But that is, you do things from instinct.
Right.
But that means you're basically reactive. But if it worked, it had to be conceptually sound, theoretically healthy and logical. So I could break it down in terms of brain arousal. Those 3 examples I gave with the ticket, the woman crying in the waiting room, and this angry guy. I could break it down conceptually, theoretically. And because I could break it down, instead of just being reactive, now I could be proactive. When I get somebody, I already know this is a possibility where I will go to it. In other words, so people did not do their drawings and say, well, I'm going to draw this, and this is going to be the golden triangle, the golden ratio. No, they did it, and they go, hey, you know what? There's something being duplicated here all the time. Or they look at attractiveness, and they go, yeah, that person's attractive, that culture, that person's attractive, that culture. And you know what? They're all attractive because of certain features, eyes, and largely about symmetry. Well, now when you do art, what do? You draw things with symmetry. In other words, you can be proactive. So that's the difference between myself. I say character myself as a newer therapist way back when, is my instincts were pretty good back then. I say they were very good, but I didn't have the experience or the confidence necessarily to act on them. Now I just follow my instincts, because I've had enough experience to know that they make sense conceptually, or I could be proactive, or I trust my instincts are probably right and I'll figure it out along the way. And that's the difference. So it's really a confidence difference. I mean, people who are more veteran therapists, I mean, what do you speak to that in terms of that instinct and confidence aspect of it, the having experiences that validate your instincts? Anne or Carmen, you're among the more veteran people here as therapists. What do you think?
I guess I would say that it's, and Rosa would resonate with this, I think, with attachment based, is that attunement, if you're attuned to your client, and then the other piece is kind of knowing where you're at yourself, your interaction, your countertransference with whatever their issues are going on with people. So you kind of know where you might step in it or get into trouble and be more about yourself. But you're staying attuned with the client, then to a large extent, you can kind of, go with what your instincts are, go with what feels right to you. You can kind of lean into it, but you have to be attuned. If you're not attuned, you can get in trouble.
You're trying to get them. You're trying to get them. That's what attunement is. Yeah. Carmen, you have a, go
I
ahead,
just,
Rose.
well, I just wanted to say that the feelings are valid. You know, feelings are always just their feelings, and to attune and to validate each person's experience is incredibly healing, actually, and it allows the nervous system to go, oh, like I don't have to fight to have my feelings seen or to be seen. I can just relax. I don't have to fight this anymore.
Yeah, you know, a great therapeutic intervention that I use is somebody talks about what happened at work or at school. They go on for several minutes, and I look at them and I go, "Oh, that sucks." And that's the, you know, you said, you see them like you said. Somebody got me. I'm heard. You know, and the whole body just changes because they're so used to being rejected. You know, and sometimes you see people rejecting themselves. One of my very memorable sessions was with a woman who was trying to decide whether she should leave her husband or not, because he was cold and all that kind of stuff and everything else. But they had a couple of kids, and she had met an old lover, and you know he was totally not a person for the future, but he sure was a good fun play person. All the stuff she wasn't getting in a relationship, but then all this time and everything, she decided she said she's sitting there in session telling me that she's going to stay with her husband because it's the best thing to do. And while she's doing it, her whole body is crushed and tears are welling and stuff. And I told her, I hear what you say and your body's telling me something totally different. You're telling me it's okay and it's a good choice, but your whole body's telling me it's not. You know, she wasn't telling herself the truth, you know, and she was out of sync. So that's about being in sync. Carmen, you ever thought about these things?
This was the worst timing, exactly when you were talking about that. My husband popped in the room and said, "What do you have for the laundry?" And so I was addressing that. But I was also thinking before with a woman responding, "Yes, damn straight you talk like that to a guy," because that's something I struggle with where, you know, what you're saying, and Terry Real does that kind of thing too. And I will use profanity sometimes when I'm not sure if that's okay. And then I always wonder if that was okay to do. But to imagine, you know, I'm thinking of right now I have this acute crisis situation with a client, and it's I don't know how much of it is a racial issue. He's Black and she's white, and he's completely financially dependent on her. And there have been repeated incidents of him lying to her and, you know, pulling one over on her. And yesterday it happened, or this week it happened again. And she said, "I'm done with the relationship." And then she's begging me to help her, you know, help her get rid of him or whatever. And I can't fathom me, a white woman, saying to this Black guy, "Why are you being such a motherfucker, you fucking liar and piece of shit?" I can't imagine myself saying something like that. And yet that's what she's saying to him. And he's just saying, you know, "Well, don't be so hysterical," you know, or something like that. And she's got all the evidence, and he just says, I didn't do it. I don't know what the problem is.
So, how are you going to learn how to do it? Practice.
Practice? Just do it anyway?
You know, practice. You know also what practice means? The acceptance of doing something poorly.
Until you get it right.
Until you get it better.
And even then, yeah.
Yeah. So, you know, I'm pretty practiced at cussing out clients and teenagers especially. But it's a lot of practice, and the conceptualization, you know, gets me there. But also, you know, I'm really good with women who had emotionally distant, unavailable, or abusive father figures. Makes sense. We have two daughters. You know, I have a compassion. I'm sane. I got good boundaries, and all I got to do is be sane. But I have a lot of practice in that because such people pop up in my therapy pretty regularly. But it's practice. But you know, it's the going outside your system, your process. So ignoring yourself or ignoring anger, you deny self and their own worth, tends to intensify anger. You know, now it intensify where it can be intensify in the moment, or it can intensify in terms of being explosive later on. And you know, so this Madeline character, she tries to avoid direct anger, but avoiding the anger she doesn't engage, which means what? Dirk feels dismissed. He feels ignored. What Rosa was talking about, you know, and she would even say, "Hey, you know," and you hear this with couples all the time. Oh, that happened. We got past that. We got past that. You know, it's like, you got past it? Like you tied the dead corpse to the back of your car and just dragged it behind you for the last 5 years, you know? And now there's another dead corpse you're dragging behind you as well. You know, this is nice and dramatic. I do this all the time. Is basically, you let it go. And this is my metaphor, let it go. Oh, you let it go. You took it and you crumbled into a little hard rock of resentment. It's just so much better in person. You crumbled a little hard rock of resentment, you dropped it, you let it go. And then something else happened. You took that, you crumbled that little hard rock of resentment, and you let that go, thunk. And eventually there's this mountain of resentment that becomes volcanic and radioactive. So, one day it explodes. Great quote about resentment. Resentment is like taking poison and waiting for the other person to die. You know, it's the list of grievances, you know. And that's where the resentment moves from, where anger moves to hostility. The hostility where, you know, it becomes stuck, you know, and ready to be triggered. Now, let's speak to this for a second, which is that, speak about passive aggressive. In this patriarchal makeup between the two of them, you know, and again, it depends on, you know, the gender stuff, but also in same-sex couples, the principles still could be relevant, depends on what people internalize, either from gender stuff or from just personal part of it. And the passive aggressive is essentially aggressive with plausible deniability. What? I didn't do nothing. No, it's you're not doing anything. It's the silent treatment. It's like doing half of what was asked for. It's about the exclusivity part of it. By the way, in domestic violence dynamics and aggression, is that actually I will talk about that, about bullying. There's a stylistic gender differences as well by gender, but not exclusively by gender, but the principles are, which was hierarchical type of bullying versus relationship type bullying. We'll get to that later on. But passive aggressive, plausible deniability, you know, that I didn't do anything. But you always have to remember, passive aggressive, it's aggressive. It's aggressive, you know. And in this particular scenario, one of Dirk's complaints will be, you know, and everybody thinks Madeline is such a sweetheart, and I'm always the asshole. Everybody thinks I'm the asshole. Her family thinks the asshole. My fucking family thinks I'm the asshole. You know, because, you know, I'm bigger, I'm louder, I got this beard and stuff, and she's all innocent and everything else. But she, you know, she gets in tons of shots, you know, all the time. You know? So part of this dynamic in general couples therapy is holding her accountable for her aggression. How she does these little jabs and attacks and so forth, you know. In other words, you know, it goes both ways. And that's the responsibility issue, remember? You know, being defensive is not owning your responsibility. You are responsible. So what are you responsible? You don't do this, you don't do that. I remember this one couple, I talked to them and I said, so, you guys get into a lot of fights? Yeah, it's been tough. I says, so has she cut you off from sex yet? And she goes, no, I don't. And he goes, 3 months. He was counting, you know? And that's easy because any given night, not in the mood, not in the mood, not in the mood. Why aren't you in the mood? Because I'm tired, because the kids are busy, you know, because of this, because of that, whatever else, you know. Or maybe a deeper level is that I don't feel intimacy with you emotionally, psychologically, spiritually. So hell no, I don't feel any sexual intimacy towards you. And you know what? And I know you want it. I know you want it because as long as you have intimacy, like a lot of the male stereotypes, if you have sexual intimacy, you feel that there's intimacy, well, I don't want you to think that things are okay. So screw you, because we ain't going to be screwing. You know? passive aggressive, not in the mood, whatever, justifiable, and he feels it. So that hostility. There is something I do in the self-esteem workshops. I call it messages of worth, which is basically what are the little messages of worth that people give each other. So you could do the big fancy vacation, cost $10,000. You could buy the diamond ring that costs a hell of a lot of money, or you could bring somebody a cup of tea, or you could walk past and rub them on the shoulder, or you could notice that someone did their hair different, or you could see something on the internet that they would find funny and you share it with them. What are those? Those are little messages of worth that you matter, you count. And if you look at them as a message of worth, the $10,000 one versus the free one versus the $5 one, they're all the equivalent. So how often do you want to get those? How often do you want to get those? All the time. And part of the passive aggressive process is, generally speaking, some people by culture, but also especially by gender, are taught to give those messages of worth, those constant validations. And then when you're not feeling it, you remove them. And the guy walking around going like, something's different. It doesn't feel right. Well, yeah, because you're not getting these little strokes that have sustained you all this time. Whether you give them or not could be part of the process of therapy, as well. And then it becomes the hostility there. So, what are you going to do is that part of this assessment is couples therapy going to be appropriate or not? Okay? Is it going to be appropriate or not? And it really has to do with this continuum. And part of the continuum is that, and I know Rosa is really into, and I totally agree with the principles of attachment theories and so forth. And that was a total eye-opener many years ago when I forget his name. But a therapist did a training about attachment theory and domestic violence. I was like, oh, damn. Oh, gosh, damn. That totally makes sense. So basically, on some kind of continuum, if attachment theory fits in there, but that has to do with a issue of violence or aggression that has to do with frustration, pent-up issues, to a degree of how much frustration, how deep, deeper wounds, and so forth, and then to this point where it's not about this internal process, but it's about frustration and needs and so forth. But it's what's called instrumental domestic violence. It's violence to achieve something, violence to control. Okay, that's a different issue. And that's where, quite reasonably, and I tend to agree, where couples therapy is not going to be productive. In fact, it may be counterproductive. It may harm the victim as well. So that's the call. But at the same time, you don't know that at the get-go necessarily. You find that out in the interactions, in the controlling aspects of it. So, yeah, we could do things to help them do that, but it's like, is it going to be effective? We could do stuff like teach people how to verbalize stuff, do writing stuff, do problem solve, have them negotiate. Now the other thing is about incremental change, which is that I believe very strongly in, which is what can we do in couples therapy? We got to see if it works, because this is my whole philosophy premise of how to do. See, is this the next one? Okay, well, not quite, but can we do therapy? Should we do therapy? How does therapy work? So everybody wants to make things happen quickly, and I have 2 magic wands. Bring, 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 bring. Stop dating assholes. Have anxiety and make good choices. So I got a fancy fairy one. I got a more secular magic wand. I wave them at people, and they don't work. They don't work. And essentially, clients will ask you, and couples will come in and say, make us a happy couple. Make us a fulfilled couple. That's nice magic. That doesn't work, though. So what does work? You know, and this is what I believe in therapy in general, is that we want qualitative change, which is big change. Big things happen all at once. But reality is the only thing we can work on is quantitative change. And quantitative change is incremental change, a little bit at a time. I'll break that down more specifically into 5 categories. One is frequency. Okay? If you have a fight every day, 2 times a day, every day, that's nasty. If I as a therapist and we in couples therapy work on stuff and you get yourself to fighting once every other day, you're still fighting. It's every other day instead of twice a day. If we could get you to fight 2 times a week instead of once every day, that's a change in frequency. Once a month, get to once every 2 or 3 months, once a year. That's the difference. Now, that's negative frequency. We can work on that. Also, there's positive frequency, that you have moments of intimacy once every month, that you have this connection once every week, a couple times a week, a couple times a day. That's a change in frequency. We can work on that, and we could do things to facilitate that, okay? The second one is intensity, quantitative change. Something happens, and you hate this motherfucker. You can't stand him, okay? That's a high intensity, as opposed to something happens, and you're mad as hell at them, which is not the same as hate. You know, something happens, and you want to get a divorce because you're so mad and so hurt, versus something's happened and you need to avoid your partner for the next hour. That's a change in negative intensity. Change in positive intensity would be that something happens, you feel good, and it lasts for an hour. Something happens that you feel good, and it lasts for a day, a week, whatever else. Positive intensity. Change in frequency, change in intensity, change in duration, which is that you have a fight, and it's a 3-week, massive mega marathon. You're in the octagon cage, beating the crap out of each other. But now you have a fight that only lasts a week. Now you have a fight that only lasts for that day, and the next morning you're okay. You have a fight, it's a 1-hour fight, it's a 15-minute fight. The duration of the fight, which is also the duration of the afterglow of positive intensity, that you feel good about each other, you feel trust, you feel intimacy. It lasts this long, it lasts that much longer, that much longer. Change in frequency, change in intensity, change in duration. Change in resonance. Resonance means that something happens, how much does it resonate for the rest of your life? In other words, something bad happens, and then you're grumpy at work. Something bad happens with your partner, and you kick the dog. Something bad happens, and you're driving, road raging as you're driving. As opposed to positive resonance. Something happens, and then because of that, you're more likely to help somebody else at work. You're more likely to volunteer because it vibrates through the rest of life in a positive resonance. So frequency, intensity, duration, resonance, you can work on those things. And the 5th one would be benefit versus harm. Something happens, and you can't function for a day. You drink, you yell at your kids. That's negative harm. Versus, and you reduce that so that you're just in a mood, so to speak. Or positive benefit is that because of that, you're able to do positive things, have a good outlook on life. So these are arbitrary and conceptual. However, if you continue to work on frequency, and there's improvements on frequency, duration, intensity, duration, resonance, and benefit, over time, developmental theory basically says you hit a critical mass, accumulation of all these things. And then what happens? Magic happens. You jump to the next level of intimacy, of closeness. So now you're a couple who loves each other, gets along, you're a good couple. Successful, healthy couple. That's what you can work on. That's real. And anything that promises magic is bullshit. Or it's drugs. And they wear off. But what happens is that if you do something that's amazing, like the story I told about my client about his issues about abandonment, it wasn't that I did that intervention. We talked about it. And he was, boom, he was like that. It was months later with other work and other processes, other interactions, accumulations of quantitatively of other experiences and interactions that when he was in that moment, the critical mass hit, the crisis hit, and he got it. So qualitative change comes from quantitative change, and the only thing you could work on is quantitative change. I think that's a big, big, big deal. And anybody who proposes a therapy or process that promises qualitative change without quantitative incremental change is full of it. I think they're full of it. I just don't believe it happens. Okay. What do you guys think about that?
Well, I
think
just wanted to,
that's a big deal, I think. And I think it's a
Yeah.
major big deal.
I wanted to say, like, on that note, with each incremental change, I'm really big on validating, even if it's like the tiniest little movement, that as the therapist, I think it's really important to notice, like, oh, you fought only 15 times today. You know, or like, you know, just really, this is a big deal. Even though it seems little, it's a big change. Like,
Right.
Let's validate that. Bravo, you know.
Well, that's applicable to so much stuff. I mean, you know, Rosa and I have been in staff meetings, faculty meetings at Weiser, and I complained about, you know, yeah, we're going to make a statement, big whoop and all that stuff. But it's also, the bigger picture is, in terms of incremental change, you know, me being 66, turning 67, following history and so forth, is that there's been more and more quantitative changes. And the hope that I have now is that we've hit a critical mass of outrage, of awareness, of understanding that there's going to be this qualitative change. But I'm not sure yet. You know, that's what I'm waiting for. I'm hoping for. But it's not going to happen magically. You know, Paul George, is that name right? Paul George, Breonna Taylor, those people who got killed. It's like, is that enough? I don't know. You mean, you know, other people, other lynchings and murders and what killings weren't enough? You know, but quantitatively, have we hit a critical mass? You know, is in fact, is COVID and the quarantine part of that critical mass of quantitative changes? You know, having a pretty dysfunctional government and a pretty screwed up president, is that part of it? This sounds horrible, but is that president a necessary ingredient to hit this critical mass? We have to be this messed up in order for it to happen. You know, so, but that's the and that's also the other part of it is it takes a crisis for people to come in therapy. And by the way, one of the crises that people brings couples therapy is a domestic violence incident where the cops got called. Opportunity, you know. So making sense of that. But the quantitative changes, you know, the quantitative changes is just what you can really work on, you know. Other quantitative stuff, some factual stuff. By the way, if you can't tell, we're going to continue this in 2 or 3 more seminars because there's just so much stuff to talk about.
Yeah.
So just a little conceptual, a little factual stuff. Abusive males have higher levels of anger-related concepts, jealousy, rejection, abandonment, attributing greater negative intent. This is a big deal, is that and one of the assessments, which is that how much does the perpetrator, ascribe their aggression or violence as an internal process or an outside process? That's where I was talking about not using the personal pronoun I makes a big difference. I got upset. I'm fragile. I'm under a lot of stress. I this versus they that, she that, he that, whatever else is that externalizing. And if I remember right from my UC Berkeley days in psychology, it's called the external versus the internal locus of control. You know, And basically, as therapists, we're working on their internal locus of control, that they have the ability to see on their own process. But the external locus of control says there are institutions. There is embedded racism, sexism. There is other people's actions as well. But the balance of that. Then there's okay. So in this character Dirk, the more Dirk blames Madeline for purposely harming or disrespecting him, the whole thing about being disrespected, being embarrassed in front of somebody else, a particularly male issue, fragile male ego sense. The more objectified the anger becomes, hostility increasing the risk for abuse. Women have the same issue in terms of gender, in terms of the being disrespected, but men are bigger, and the culture promotes physical aggression, accepts physical aggression much more so. In fact, there's statistics about research where it says when is a spouse entitled to be physically aggressive, and men always come up higher, much higher in terms of they're entitled to. They're entitled to. By the way, as I speak to that entitled is one of the 4 major characteristics of narcissism. Entitlement. This matters. We're going to talk about that. Quickly, we'll return to it later on. Different ways to look at narcissism. Omnipotence, I'm the best. Grandiosity, I'm special. Self-righteousness, I hold the high moral ground, and everybody else is morally fit. And from omnipotence, grandiosity, and self-righteousness comes entitlement. Which means what? I'm entitled to do this. I'm also entitled not to follow the rules. The rules are for the muggles. They're for the small folk. They're for the less special people. I'm special. I'm entitled. What happened in domestic violence? That's one of your assessments, which is if a perpetrator feels that they're entitled to the violence, they're at a higher level, much higher level, as opposed to they go, I fucked up. I really messed up, which means I am not entitled. When I challenged that guy screaming at his wife, there was a subtext of you're not entitled to do this because it violates the rules. Your rules for yourself, but the rules as well. Sexual aggression. Some people do their violence sexually. Partners can rape, sexually abuse, or hurt each other. There's a connection there. Here's a definition that's maybe useful. State anger versus trait anger. State anger, do that assessment, was the presence and intensity of angry feelings. Maybe you can look at it as presence and intensity of angry feelings that are always there, that are part of the person's personality, psyche, history. And then trait anger, which is the tendency to interpret circumstances as annoying or frustrating. Okay? Interpreting. Now, what this is starting to imply, which we're going to get to, includes some looking at paranoid personality disorder. Because paranoid people, they always are angry. They're always intense. And they're highly triggerable. In some ways, I did a training for camp. It's about how dangerous is this person, how dangerous is my client. It's going to be, it's taped, so it'll be available for the virtual conference. But it's based on one of my books, which is online as well, on my site as well. And basically, I think that a paranoid personality is more dangerous than a sociopath. A paranoid personality is more dangerous than a sociopath because a sociopath wants to get away with it. So if they can be caught and punished, they won't do it. A paranoid gets to a place where they don't care. In fact, getting caught, having that blaze of glory is part of their thing. That's why they're hella dangerous. Okay. So here's a premise about can we do couples therapy? The implicit foundation of couples therapy. It comes from both partners accepting that the hurtful partner is held responsible to stop. There's no tolerance. This is not okay. This has to stop. What does that go directly against? That goes directly against the entitlement. You know, so that's your assessment. Are both members agree that this has to stop? There's no entitlement. There's no justification. And I've worked with people where they say, right, there's no justification, this has to stop. And then the subtext of the next rest of therapy is, then they do all this stuff to justify, which is like, okay, that's bullshit. You know, you're still saying it's okay. You know, that she made you that crazy or he made you that angry. Okay. So domestic violence therapy holds both partners accountable and mandates protection for their violence. Often that means multiple interventions. So this is another issue, is that domestic violence therapy, like Rose, you did groups, right? So that's pretty standard. Groups for victims, groups for perpetrators, and individual therapy, each probably, and maybe couples therapy, because there's so much stuff going on, so much going on to do that. So couples therapy has to be safe, okay? So you want to see, you know, in your first segment, so Madeline and Dirk are doing their sessions and so forth, and what you're watching, you're doing the therapy, but what you're watching for, you're watching because knowing that he's the volatile one and he's really aggressive and everything else, you want to see what degree she's intimidated. You want to see the body language. You want to see the looks, you know. I always remember this one couple that I worked with, and I'm talking to him, you know, about stuff, and he's really animated and assertive and everything, and she's kind of looking at him like, you know, waiting for him to be explosive. And then when I'm asking her stuff about her accepting, giving permission for his anger and naming what he does as being abusive or not, she's trying to talk to me, but as she's talking to me, she keeps on doing this. She's checking. She's checking to see if he's getting inflamed. She's checking if he's getting aroused. That's intimidation. You know, one of the things about violence, and also I wrote a book about temper tantrums, is that the temper tantrum or the violence is intimidating. But there's a point where the possibility and the history, the possibility of it happening again because the history of happened before, in of itself is already intimidating. So that's an assessment. Is this person intimidated? And that's a subjective thing. Or you could ask overtly, what can you say here? Is it okay to say everything? You know, I remember asking somebody one time, you know, because I'm picking up some tension. I asked her, I says, is anything off limits here? Have you guys talked about ahead of time? Anything off limits? Hella direct. And whereupon immediately she looks at him, you know, and he gives her a little steely eye. And I go, seems like something is off limits. So what's off limits? You know, and I turned to him and said, what's off limits? You know, what's she going to bring up that you don't like? You know, then I could look at her, ask her. And it turned out to be two things: was his drinking, classic, you know. The other one was, it wasn't couples therapy. They were mandated to do domestic violence therapy. You know, so, but you could tell by the body language. The body tells. You know, the body tells. Don't just listen to the words. The body, how people say things, their tone, you know, all your instincts is kind of that, the therapeutic spidey sense. It's like, tingly, tingly, something's up here. You know, follow it, chase it. You know, and you often find the truth at the end of the trail. And when they lie to you, you could tell that too, and you can come back to it, deal with it later on. Now, and this is where remember I said that you as the therapist is crucial because do you interrupt? Because the victim is watching you. I'm in a room with my partner who may be abusive or has been abusive, and I'm in a room with somebody who's here to be a witness. Are they going to see anything? Are they going to notice? Are they going to do anything? And if you don't, you failed them. Horribly failed them. You know. On the other hand, if you notice the tension, you notice the nervousness, you ask about it. You know, what's this about? How hard was it to get in here? So I know I have a sense of what you hope to have happen here. What are you worried that might happen instead? You know, and basically I point them down that trail. How can this go to hell? You know, how might this therapy get killed? And oh yeah, there's another thing, which is a more general thing about couples therapy. Usually when I get a call for therapy for a couple, that person is usually the person who's invested in therapy. And I spend time on the phone, sometimes sometimes up to an hour on the phone, because I spend a lot of qualitative time to start building rapport, start understanding stuff. And I get a good sense of them, which means when the couple comes into therapy, I almost ignore that person, because the other person is the potential therapy killer. They're the one who's going to pull the plug, And I'll never forget, to my chagrin, a few times where someone came in therapy, I had this great rapport with this one person, interacting with them, great and everything else, and boom, she calls later on and cancels the therapy. Damn, I blew it. I should have picked up on the narcissism and control. Because I didn't kiss her ass, she killed the therapy. Now, I don't mean you actually should kiss your ass, but there's a way to handle narcissists as well. But you need to know that. So who is the therapy killer? That's the same thing if you have a parent who brings a teenager into therapy. The first session, if you have the parent in there, they're the ones they're both therapy killers. Actually, the kid's a therapy killer because if they're invested in you, they'll do it. The parent needs to find you credible, so you got to manage both of them. It's a little slightly different situation. Individuals come to therapy, they're already committed to therapy. They're already invested. It's a piece of cake, It's easy in a lot of ways. Or you're further along. Very provocative question that becomes an issue because the principle of not blaming the victim. But if Madeline describes Dirk as being hurtful and abusive, then the question to Madeline is, so why do you give permission for this? Well, I don't give him permission. I tell him all the time that this is messed up. I don't like it. And you've been telling him this for the last 15 years? And you stayed? And you made a couple of babies with him? Had 2 houses with him? So you stayed. It doesn't seem to be given, it doesn't seem to be saying no. So why do you give permission? Now, that's a deeper question, which is not about blaming the victim, but what is it about this person that accepts that person? I had this hilarious email interchange and a phone call with a client. Client calls me, so-and-so referred me to you. My partner is narcissistic. That's the email. And my immediate thought is like, well, why the fuck are you with your partner if the partner's narcissistic? Kind of duh, So I call her, we talk, we spend a good 45 minutes, and she's not the therapy killer, obviously. She's invested in everything else, and she tells me the history of this and that. And he says that she owns it, all that kind of stuff. He owns it and all that stuff, that he's narcissistic. And he says, okay, I'll let my partner know and schedule an appointment. And then a couple of days pass, and she emails me and says, okay, we're ready to schedule an appointment. What times are available? So I give her some times. And then another day, the email comes back and says, well, he wants to see you. He doesn't want to see you online because he wants to see you in person. And she's all pissed off. She says, it's a quarantine. Everybody knows that you got to see people online. And before, he had told me he didn't want a female therapist because she would align with me, that he wanted a male therapist who would understand him. But now that I got him a male therapist, he wants a female therapist to teach him how to talk to women.
All right, so.
And he only wants to do it. So I sent her an email. Basically, I figured, what the hell? Why not? Go for broke, And I basically kind of reamed her therapeutically. Why are you putting up with this crap? I did it in a nicer way, but it wasn't all that nice. Why are you putting up this crap? Why are you giving him another chance? What's going on here? It's over, so on and so forth. He's wasting your time. He's wasting my time. And then I decided, what the hell? By the way, this is in the email. I said, you could tell them that I say he's full of shit. Why not? You know, and that he wants, I said, this may sound a bit harsh or unprofessional, but I'm very direct. Maybe he can't handle this. But if he's strong, but if he can, I'm available. Paradoxical intervention, a challenge. Okay? That's a paradoxical intervention, it's purposeful. Okay? Wait a couple of days. Okay, I blew that one. Or like, what the hell? You know, might as well go out in flames. An email comes back a couple more days later, and he says, he's willing to see you now, but he doesn't want to do it online. Can you do it by telephone? And I go, an email says, no, we can't do it by telephone. You know, that don't make no fucking sense at all. That's bullshit. First, he wants to not see it in person. Now he doesn't want to do it online. Now he's going to do it telephone. It's more control bullshit, you know. If he wants to do it, it has to be this way. Only way to do it. So I basically set the boundary because she's right. He is a narcissistic asshole and he's still trying to do control. I ain't fucking playing. You know. And he never shows it. He doesn't make the appointment. And then after a few days, I tell her, maybe you should see me in therapy. And she hasn't come back to me yet. But those 3 or 4 email exchanges, that was the therapy. In other words, I call you on your stuff. I call him on their stuff. And you do what you need to do. But, you know, and this is another aspect of domestic violence, which is not physical violence, not emotional hurting, but control. To what degree does control and controlling becomes abusive? Controlling could be physical, blocking someone from leaving the room, but controlling also can be about blocking communication, demanding things and reasonable boundaries and so forth. You know? So there's, you know, and how come she's accepting it? What is all that about? And we'll talk about that a little bit too, because there are certain partnerships who's vulnerable to being abused on some kind of continuum. At some point, some people this is why some people they're kind of like totally perplexed at how someone could allow themselves to be in an abusive situation. Well, there's reasons why people are more vulnerable. So big issue. So the power dynamic is issue. You know, they Dirk and Madeline, the power dynamics weren't addressed. They did couples therapy. You know, they did communications work. Madeline didn't feel safe. You know, so couples therapy might be appropriate. This is a little nuance, almost like double talk. Couples therapy may be appropriate if the violence is an expression of emotion. Might be appropriate if violence is an expression of emotion without prior history and genuine remorse. Remorse is a big deal, okay? Versus instrumental violence, which is the violence is used to maintain a goal. In that second case, maintain a goal, the history of control. In that second case, the violence could be even kind of cold-blooded. It may not be hot. It'll be pseudo-logical. So what's the shorthand of that? The shorthand of that is less screwed up people the domestic violence is not going to be as severe. Less screwed up people are probably amenable to couples therapy. More screwed up people, it may not be such a good idea in lay terms. Okay, precondition. Each partner wants this type of therapy. Victim has a safety plan. The client I'm working with right now is talking about separating from her husband. It's a matter of timing. I've talked to her over and over. What's your safety plan? My friend has a key to your apartment. What's your code that you're going to send her? Is she going to come by herself? No, she has a 6-foot-tall partner who will come with her. You know, in other words, there's a team that's going to be there. I know somebody who was in a situation where the team, which was a husband and wife, came on the call, the husband had to break the door down. You know, it could be that severe. You know, now ideally, the therapist be trained in domestic violence, but here we're talking about the dilemma is that sometimes it ambushes us. We're not necessarily aware of it. And you know, there's a lot of recommendations of having two therapists, especially if it's a heterosexual couple, is that one male, one female. You know, but a two, you know, but two principals. Here's a nice recommendation: if it actually could do it, neither partner is abusing alcohol or drugs, which kind of goes back to that classic one that says, I do therapy with people as long as they're not drinking or doing drugs. That's their problem. And their problem is why they use drugs and alcohol. In other words, if they get rid of their problem, then they could come work on the problem they don't have. Huh? It's kind of like circular. So it sounds good, but there's some issues with that. The risk for danger is low. Okay, that's a tough one. And of course, why you look at the cycle of domestic violence, is that the cycle is pretty profound. But one of them is that, you know, at what point it's the greatest danger. And we know at the point of the greatest danger is one person's leaving. That's the greatest danger. That's when the rejection, abandonment, betrayal is the most profound, the reactive part of it. And anger is an empowering emotion. We do that. Okay, so intimacy is the goal here. Now, let's see. I put to this slide, but we haven't talked about anything about the slide per se. Let's see what you guys got right now. What you're thinking about. We got more stuff to do. We're on slide 3 kind of, and I have a dozen more slides. But so this is why we're going to do more stuff, because we can chat about it. So what are you thinking right now? What's your sense? So reflections upon being part of a couple, knowing people who are couples, and having done therapy with couples therapists, as a couples therapist, and also domestic violence situation. So if we could take turns, let's have everybody reflect upon those things, you know, rather than me talk for the last 15 minutes. Tori, you got some reflection. Tori, part of your work is women's studies, right? Yeah, could you maybe speak from your place and your work, some reflections upon what we've gone through so far?
I found what you said and the way you look at things to be very helpful and definitely related to what I've learned in women's studies in terms of looking at the cycle of violence. I think what you're doing and how you do it is very informed and brave, and the whole way you talked about jumping on the stagecoach thing, you know, and redirecting it, I thought was very interesting.
Hey, Robert. By the way, I keep on calling you Bobby and Robert. Which one do you prefer now? I think I knew you as Robert, but then I also know you as Bobby too. So you prefer Robert? That's where you were in middle school. From your world, what are you hearing, and how does this resonate? What do you think?
I found it very interesting. I don't, you know, I don't do psychology, but I do sociology. But you know, I found it useful and very interesting. I mean, I do stuff on violence, you know, social violence, like Tulsa and lynching and how the Holocaust and Rwanda and stuff. But so global violence and so on, but and conflict and war, and I mean, there's parallels to the psychology that you're talking about in relations between peoples and states and stuff. But yeah, so I found it very interesting and illuminating.
Yeah, I find it, you know, and that's part of my orientation, also Wiser orientation, is that, you know, from the macro to the micro, you know, from the individual to the larger part of it. It's so many relationships. This is why when people are carrying on about, you know, therapists for social justice as well, this is why I got education in therapy in the first place. Is all related to social justice. It was my piece of it, you know, but it was all about empowering people and respect, dignity, things like that. So it all kind of fits in from from the bigger to the smaller communities. Let's see. Nicole, I'm just going to arbitrarily and try to go around. Let's go to give you a little moment to prepare for it. Give Nicole. Let's go. Nicole, Mary Beth, Stephen, Carmen, Ann, Elenia, Alex, and Crystal, if you could actually chime in. And Rosa went on and off. Nicole, you got any thoughts?
I mean, I really like your comment about the how it's applicable to micro and macro and kind of how that fits together. Yeah, I'm really just absorbing what you're saying. So I don't have anything in particular at the moment.
Cool. And Mary Beth, and Mary Beth has experience with labor and union stuff. So I wonder, how much stuff resonates in the violence done in labor. So what's your thoughts about that? Anything
there is a lot of violence in labor. Unfortunately, though, people are in a situation where finding a job and quitting isn't always possible. So the violence is definite, it's hard, and it's why people form unions. It's one of the reasons why people form unions is to gain more power. But I digress. I haven't really thought about it through that lens in a long time. So I have to refresh that muscle and thinking about how it is in labor specifically. There's a lot of, as always, there's a lot of good information. And I really like the breakdown of, I think it's the 4 seasons of 3Ds. I think that there's a lot of, they're good benchmarks to be able to assess where people are at, and just thinking through about how to level up people so that they can get back into a place where it's just complaining. So it's an interesting. I really like that piece.
Stephen, what you got for us?
A lot of things you said kind of resonated, not particularly with couples per se in my experience, but a couple of things you said just I kind of noticed being either things I was practicing in direct therapy or things that make a lot of sense. I think the idea of confronting equaling resolution and justice, you got to get through pain. I see that quite often, a lot of people tending to not confront those things, putting them aside, trying to pass it over or get through it, but not actually experiencing it, and then wondering why they're kind of stuck in this conflict, but not able to really get through it. I think confronting it and processing it's extremely important, and I appreciated that. Let's see here, and with what Rosa said, I do think the idea of validating qualitative changes, I tend to do that, little small, anything positive in the right direction, really validating that I think's important to kind of solidify those qualitative small changes. I think it's qualitative is the smaller
Quantitative and quantity. Qualitative is changing quality. That's the bigger one.
Backwards there. I do know that though. Don't worry.
He's an educator, so you do know that. Yeah, sure.
But I definitely think that's important and really highlighting that for people so they acknowledge that although it might seem minute, it is a step in the right direction, and really validating that I think is a key to making those positive experiences really count. Other than that, a lot of things I was just kind of relating to individuals, but again, I think individuals equal a couple. So I just thought a lot of those points were really important. So particularly those things kind of stood out to me.
Okay. Carmen, and then Anne. Sound?
I'm sorry I had to miss a big chunk of this. And like I said, I didn't really know what it was about. I was looking, I had texted Ann at 1:18 a.m. And then the response this morning was, I think you might like this. So I did my entire trainee and internship, had a few others, but that entire duration was an agency that did domestic violence, which also included sexual violence within that. So once I was licensed, I never put that down as a thing that I know anything about because it's so challenging. And it's a challenging thing to do as a beginner when you don't know what you're doing. You really struck a really valuable, I shouldn't say nerve, but the example you gave of telling the person who says, I want couples therapy because my husband's a narcissist, and you want to say, well, why are you with him? And then later he agrees to the therapy, but it has to be in person. Then he'll agree to doing it, but it has to be this. I get that so much, and I never made the connection. I just kind of get annoyed, and I try to give the benefit of the doubt by saying, they're just naive and think that I'm fine with seeing them at 10 a.m. on Sunday morning or at 7 p.m. on Friday night. And I guess people just think that's normal, but I get that so much. And I tend to take on a more defensive position of, well, is there any other time you could do besides Sunday at 5 p.m.? And now you give me something to think about, to meet that with better boundaries, and keep in mind of how much is this the person who doesn't really want to come.
Yeah, and we'll talk some more about narcissism in particular, because and it's all on a continuum, but that controlling aspect of narcissism, omnipotence, and how they challenge you.
Yeah.
There's some funny stuff I talk about. Is like, among the things is that, wait a second, I'm the therapist. You're not the therapist.
Sometimes we're suckers. We just say,
Yeah.
well, I'll let it go this time.
That's a long time ago. I smelled those narcissists out. One of my books is it's called The Scorpion in the Bed, which is about narcissism and in couples and couples therapists and therapy. It's about that scorpion in the bed. And it's like, once you start to understand them, you're at an advantage. It really makes a difference. So my experience, I'll give you one quick thing about that, was my experience with this guy was a narcissist. He was taking all kinds of shots at me, and I was laughing, determined, just like dealing with all his answers and stuff. And all of a sudden I had this realization, I'm at a distinct advantage over you, because I know you're a narcissistic asshole and you don't. In other words, I even know what and why you're doing it. So it's easy for me to handle. And I reconcile and manage my vulnerability to it. I'm not competing with you. I won. Anne, what's up? What do you got? Feedback? Or what's resonating for you?
Well, gosh, I wish we had 3 more hours to cover the rest of your slides and a bunch of the content in your book, but I'll look.
In September, we'll have 3 more hours.
Oh, cool. All right, good.
We'll do second part, and there'll probably be a third part.
Yeah, thank you to Rosa for posting this on. It was probably Bay Area Open Minds, so that's how I saw it. I really appreciate the stuff that you do on transparency in this. That's a piece that I've been working on since I started as a therapist, because I came from a family where nothing was ever said about what the heck was going on. As a matter of fact, the less that was said seemed to be the main way to manage conflict. Anyway, so it's been a long, process, but I really appreciate, just the direct stuff. I'm pretty good with instinct, but just stating it, calling what is. I believe there's always a way to, as a psychologist, there's always a way to state what is. And the trick is to be able to state it such that the client can hear it. Mm-hmm. So, I can hear what I'm saying, but say it so that they can hear it. The point that I'm curious about is the, quantitative change only, and that you really can't make qualitative change. I'm still kind of puzzling as to what I think about that. So it's a very interesting question.
Qualitative change comes out of quantitative change. And quantitative change hits a critical mass
Yeah,
of
you can
enough. But
separate-
that's not something you can identify. That's enough.
Mhm.
You know, how was that intervention with that young man about abandonment? How was it that it germinated, got amplified, got experienced, buttressed by different things over several months, that at that club or in that city on that vacation with his partner and friends, that it, and in that crisis did it click?
Mhm.
That's magical in some ways when it happens. But there was quantitative stuff. It wasn't like I said it and it was done.
Mhm.
You know.
Well, and there's also, to me, there's always that tipping point between when the fear of change, is overcome by the pain of not changing, right? It's
Right.
as long as the fear of change is greater, we're not changing. We're going to keep doing because it's the better route.
So it's the balance of things. So one metaphor I use is that why does the last straw break the camel's back? Well, because of the first million straws.
That's true.
So there's a critical mass of things that accumulate, and then if you're really good, you could do the last several straws or the intervention or the thing, but somebody has to be ready for it. And they might have gotten ready for it through the process with you, but they might have gotten ready for it because of the last person that they broke up with, or that they might have got ready for it because of some movie they saw they related to one of the protagonists. You just don't even know. So there's a certain arrogance, there's certain confidence that you have that I'm doing the right things, I'm doing for good reasons, but it becomes arrogance if you think you're the one who's making it happen. I think I'm good. I think I'm really good. And, that's about closing the gaps that's closable. But what makes it closable? All these other things. Now, maybe if I'm really good, I could close this gap. And I don't have to close that gap. But that gap might just be too much. Or that I could help this one get to here so something else finishes it. So it's with humility, but also I have confidence in what I do, and I think you should too. Recognize it, and that's where the conceptual clarity helps. This makes sense. Whether you're ready for it or not is something else, personal. Is Crystal available to speak? If you are, just interject anytime. But Eleni and then Alex and then Rosa, just reflections upon what's going on and what resonates for you.
Okay, sure. Well, first of all, I really appreciated this presentation, and you've given me a lot of material for my conflict class in the fall. So I love it. I'm also trying to see how it fits with the existing ideas. I mean, most of it is complementary, but some of it's a little bit hard to reconcile. And so I think I'll send you an email and ask you some more questions about that. Or maybe you'll be covering more stuff in the next session. I also appreciated that distinction that you made between instrumental violence versus more of an emotional response, and I guess coming from attachment issues. So that's an interesting, or not interesting, it sounds like a very useful distinction to make.
Yeah, we're going to get to that.
Yeah.
We're going to get to that more substantially.
Okay.
Attachment, even more so, because it's so rich.
Okay. And then there was just some stuff that I wanted to share, because back in, oh God, it was, when it was when I was, it was at least 10, it was more than 10 years ago, and I was working with Mediation Beyond Borders, and they were doing some work to support reconstruction efforts in post-Civil War Liberia. And one of the requests from a group of women, the Association of Female Lawyers of Liberia, was for information on how to implement restorative justice practices for domestic violence. And I was like, no way, But the reason was that 80% of the women were being abused and beaten, and it's considered justified in a lot of the cultures in Africa, because now I'm working with another group in Nigeria. And so I did do the research on it, and then what I found a person who's doing a lot of work in the United States on both research and in helping people set these programs up, that they're using restorative circles for it. And she's at NYU, and she's both a social worker and a lawyer. So she did some research that showed that it was actually more effective than the standard way that emerged, which is to separate the couple, put the man into anger management training, put the women into empowerment training and all that. But the research that she found was that that wasn't really that effective for people that weren't, where the man didn't have a lot at stake. Like if it was a person that had like a good job and was worried about his reputation and so on, and going to jail would be something terrible for them, then they're amenable to that kind of intervention. But if the person is doesn't really care about their professional reputation, and if they actually can be seen as a powerful man because they engage in this violence and there's nothing at stake, then these things don't work with those populations. So what was interesting is in that the restorative approach is that the whole community gets involved, and the people that are engaged in the couple that has this issue, they pick people from the community to come and be at these discussions, and then they recruit people from the community to keep each other in check. And a lot of times the woman is also, and it is typically male on female, occasionally it's not, but it's usually that way, so that there are ways that the woman does escalate conflicts or generate conflicts and so on, and even if she's not violent. So a lot of those dynamics get addressed. In the United States, it's facilitated typically by social workers. But outside of the work that, and it's also been done with some of the Native American communities in the United States, but I'm not aware of people doing it on the West Coast, like that's being done on the East Coast. But she got tremendous flack from feminists for writing articles about this, and she was being accused of trying to undermine years and years of what feminists had accomplished in terms of trying to end violence against women. But it sounds like it's in keeping with other kinds of therapy that's being used. It doesn't sound like it's undermining at all. It sounds like it's just complementing what you're talking about. She did say that the domestic violence situation is assessed to see if it's safe. So that you're kind of saying that, the therapist does the assessment, looking at, if it's instrumental or if it's, an expression of emotion and so on. So anyway, I was thinking about that as you were talking about it. And I still think it's like incredibly challenging to work with that as a therapist because of the risks of it being violent. So I'm interested to learn more about how you can assure safety, because that's my biggest concern, is like, how can you assure safety when you know this exists?
Right. Some of the things you talked about, and that one is right there, about whether they have status and whether it is beneficial for some of these guys. Is there functional reinforcement? This is the chart that I use to train about how dangerous is my client. And basically, if you notice up and down this list here, there are different origins, characterological organs, but they also come from different characteristics. And depending on what the characteristics are, you have different entries to the work. So basically, it's like good diagnosis leads you to the best type of treatment, because it's understanding it best. So my joke is that some people spend more time and energy sorting their laundry to cold, warm, hot, and delicate washes than they do sorting out their therapeutic approaches to their clients and who they are. So in
Yeah.
domestic violence, you know, among the things you said something about these people, these men who have status, power,
Yeah.
and they get it, do they get it from being violent, or do they lose it from being violent? Well,
Yeah.
that becomes a potential entry to work, to intervention. You know, earlier I said that, you know, was remorse an issue? If there's remorse, there's potential. If there's no remorse, that's not an entry. And then these other things, arousal and so forth. But then if you look at these characteristic styles, where it comes from, there's a certain profile that goes with each one of these. You know, so I'm not going to show you the chart filled out, but that's a whole nother training.
Oh, that's great. This looks great, Ronald. That's fantastic. I really love your charts, your visual aids, your frameworks. And you make things so clear. I really appreciate what you do.
That's one of my things, apparently. You know, I can do that.
Yeah.
My form of skill or giftedness, you know.
Sorry, Ronald, I'm going to have to go really soon.
Why don't you go ahead and speak, and then Alex, what's
yeah, I just wanted to say about
resonating for
CEUs, that if people need CEUs, there's a few people who are here from my listserv. So if you need CEUs, please contact me. They're $40, and I can work on that for you. If you, my email is rosa.reinakainen. I'll just, I don't know, maybe put it in the chat. I just want to make sure if you want CEUs that you get them.
where is the chat?
Here, I'm just doing it.
Oh, there's the chat.
And
oh, there it is. I'll put some of these files up in the chat too.
Yeah, great, wonderful. And I guess I just wanted to say, in terms of assessing safety, that's really like an initial assessment thing. I mean, it's throughout, but it's you know, constantly assessing for safety. That's critical, and that power and control are at the center of domestic violence, and it's a cycle, and it sometimes doesn't look initially like a cycle, but it is. It's like the honeymoon, tension building, explosion, and it goes around and around, and eventually the honeymoon phase gets eliminated. So you know, it's good to know how to assess safety, and also how to work with anger specifically. And get really, really comfortable. Practice, like Ronald says, practice and get really comfortable with anger, working with anger. So, okay, that's all I have to say.
You know, I haven't given you, but I'm going to give that personal story about later on about anger. Why anger scares the crap out of me. You know, and how, you know, talk about transference. Oh shit.
Countertransference too. Yeah.
Oh my gosh, you know, it's intense. It's crazy. You know, so that's something that's really, really important to be able to deal with. But it actually fits therapeutically as well too. So we will, and I hope Rosa can participate and add everything. Really enjoy that. I'm trying to add this couple more onto the chat. Alex, what's up with you? What you got for us? What's resonating?
Sorry, bye everybody. I'm just gonna. I gotta pop off. Bye.
Bye, Rosa. Thank you so much.
The one thing I want to learn more about now is, how do you inspire someone who's doing, literally lying or cheating and not taking responsibility, who's being defensive that way? How do you get them over that hump of from not being responsible to being responsible? That seems like the hardest. And it also relates to Carmen's example with the guy and the woman having evidence for him being bad, basically. And how do I do that as a therapist without being moralistic, but also pointing out it doesn't work? So that whole responsibility thing is something I want to investigate.
Yeah, that's a big one.
Yes.
Well, see, I think one of the things that goes back to that determinism and relativism. The response to determinism and relativism is functionality. It's how does it work for you? And one of the things that's that sort of popped out at me when I read it was that somebody for the most part, their orientation is short term. Short term. Do I get what I want now? Do I have the control right now? Long-term functionality is very poor. You know, so if you could get them to see that, which is a big, 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 big deal. In other words, long-term, you know, so I work with this kid with Asperger's. And he's arguing with me about everything. You know? And I tell him, I said, look, dude, you know, middle schooler says, if I was a regular kid, I'd kick your ass because you're being so obnoxious right now. Or I would ignore you and not play with you anymore, and you would not ever know. Because I'm your therapist, I'm telling you, because you're going to end up without friends. You're going to end up without relationships. But in this moment, you're so caught up on asserting that you're right. You're pulling out all avenues, including insulting me, to win. And you will win because I will give up because I'll think myself, hell, this asshole, you know. But that's the short term. It's the long term. So, you know, so that is the entry. Now, do they have ownership of it? Are they aware of it? You know, that part of it. You know, and this is why one of these things is, you know, in terms of, is there a functional reinforcement? Do they get something out of it? You know, are they social? You know, are they losing social stuff? Because then you look at it and say, okay, once say simple 1, 2, 3 in a sense. You can't grow and change unless you own it. But you're not going to own it unless you're aware of it. So your job as a therapist is get them to be aware of it and to own it. Then comes the possibility of growth and change. Now, if growth and change is I'm impulsive, I'm in the moment, you know, I do it for myself. And then if they recognize, well, that causes long-term harm, then they're going to run into deeper crap. Attachment issues, trauma issues, cultural issues that make the following through harder, make the impulsiveness profound. You know, I use food as a I use food as an example. Like, you know, I know I shouldn't eat so much stuff, so much junk. Okay, but why do I do it anyway? So I'm aware. Okay, I own it. So the growth and changes, I just know don't eat so much food, okay? But then when I tried not to eat much food, then I found out, well, there's a cultural class aspect to it in terms of being from a working class Chinese immigrant family. And food is really important. In fact, going out to eat, which is why I've lost weight during the quarantine, is a sign of me making it class-wise. You know, I'm not a poor working class kid anymore. So that's why I could lose weight during the quarantine, you know. But before then, I would go out to eat and do pickup and so forth. So that's the deeper underlying stuff that comes after I try to just not do it. And this is also the division between what we do is we do crisis work, counseling, coaching, consulting, and therapy, clinical. Crisis is danger, make people safe, stabilize. Coaching, counseling, consulting is problem solving. Problem solving is don't eat so much. Crisis is I've eaten so much that I'm going to get sick or die or whatever. But the deeper reasons, therapy reasons, why I eat so much, why the person continues to do self-sabotaging problematic stuff, or why they're only focused on the short term versus the long term. So the simple way is that I describe myself two ways: how I'm crazy and why I'm crazy. How I'm crazy, for example, is I eat too much. Why is because the cultural class stuff. How I'm crazy is I'm somebody that they might be needy and clingy and smother their partner. Why is because of attachment issues. But to get to the why, you have to fail at, in some ways, to get to the why, you need to fail at problem solving. I've recommended this many times. Look up Bob Newhart as a psychiatrist and stop it. STOPIT, stop it. He pretends to be a therapist and he worked with this person, and he basically ends up yelling at him, "Stop it!" Because that's all there is to it, right? Stop dating assholes. Stop drinking. You know, start school. But why is it so hard to do? That's the deeper part. So this is why we do therapy rather than just counseling. You know, the deeper issues. And, you know, it's more than problem solving. It's why the problem, you know, how is the problem? Why is the deeper issues? How versus why? Pretty simple in that sense. To get to why, you have to go through maybe failing at the simple solutions. Stop it. Yeah. So it's a bigger journey, but that's what the juiciness of the therapy is all about. I was attaching some handouts. I don't know where my frequency one is at. I talked about it, but I didn't. This is a problem. I make these things up, and then I don't remember what I called it and named it. So, and then I try to remember, what did I call this damn thing? What did I? Anyway, if I could find it again next time, I'll send it to you as well. In fact, I do need to look at it because I couldn't find it last time. Anyway, so hope that's useful. You know, and I'll see. Weiser's giving me a break next month because I guess there's a lot of stuff going on. But we'll resume in a couple of months in September. Right, in September. And we'll probably do at least one more, if not two more. You know. And if there's enough energy and interest, this one on dangerous clients,
Yeah.
could do that too.
Oh, okay.
It's a juicy one.
Definitely.
Juicy one.
Okay.
Okay, whatever the interest. Okay, everybody.
Okay.
Have a healthy, safe Saturday. Everybody keep yourself sane and healthy.
Are we
Also,
will we get copies of all the stuff that you put up there?
I just attached it to the chat.
You can download it off the chat.
Okay, so I did three of them. So
Okay.
which ones I did? The confrontation one, the learning one, and this dangerous person chart. Was there another one that I put on?
No, that's the
You
only
have
thing.
to,
Okay, I talked about the quantitative, the qualitative, but I can't find it written up. I got it written up somewhere, but I
and you
don't.
have to download it now before Ronald leaves, or you'll lose it.
Okay,
You know what? My I disconnected because my computer died. I tried to run in the other room and connect it, but I didn't do it fast enough. So I don't have it on my chat because I was disconnected when you did it. So, was someone send them to me?
Yeah,
yeah,
I can.
or you can email me and I'll do it. I'll give you a copy of it.
All right, thank you.
And I might even find the other one. Where is it?
Okay.
I had it somewhere. All right. Anne and Carmen in particular, and Crystal, if you're still listening, awesome to have guests and have your experience and wisdom to contribute to all the people who are here. And always good to see you, Tori. And nice to see you, Robert. That's pretty cool. And everybody else, the regular Wiser people, always good to have you here too. So I'll leave my stuff on for a while to so you could download everything. I look for stuff. Okay?
Okay.
Take care, all. Bye-bye.
Bye, Ronald.
Hey, take care.
Yeah.
Eleni, I just emailed you the documents.
Oh, thank you so
Yeah,
much.
let me know if it doesn't show up. You can't see them, but
Okay. Okay. Thanks very much.
great. Okay, bye.
Bye.
Bye-bye.